stage 3.
Let's start the.
Hi, good morning to USA. Good morning to Australia. Namaste, everyone.
Namaste.
Good
morning, Ankit.
Thank you. So, we have our guest Kim from USA, and Viri is joining us from Australia, and I'm representing India. And we are at IBM on our regular live show talking about Corona and the global crisis around the world. So, let's start with Willie today. Willie, what do you have to?
In Australia, we're in stage 3, so only essential work is allowed, and all the signs on the roads everywhere says, "Please stay home. Please stay home." But the roads still seem, from a how shall I phrase this? The seriousness of it, there's still a lot of people, from my view, around the road, and that's because I've seen instances previously in different countries where in lockdown there's no one on the road, like a curfew. There seem to be a lot of people on the road. So the status is, to date we have 4,557 people that have been tested, and 19 people have passed away. New South Wales still has the largest amount, of 2,032. Victoria is also up there with 917. So that's what's happening in Australia at the moment. And what about you, Ankit?
So we have cases are growing rapidly, and we have recorded more than 200 cases for the first time.
Okay.
And there are more deaths since what it happened earlier. And so we are in a very, it's a war mode, and then we are trying our best to make sure that we'll take all the precautions. But you know that we are 1 billion people around India, and then it's difficult for us to manage those people. And a lot of people are on the road buying groceries and doing a lot of other stuff, which might be essential for them, but not for us. So the whole discussion about essential thing is different for different person.
Yes.
So there is a debate going on in India that what is essential for them is not for the other one, and that's why we all are struggling, and that's why we are taking more strict actions and trying to get the police and other things on the road so that they control the situation and they manage the things around it. And as far as the cure is concerned, we are trying our best to create more ventilators, more beds, more hospitals, more medical staff, training the staff for the COVID situation, taking all the right precautions, giving them all the right gears and security, whatever required. So that's the update from India. Hi, Sasha. Namaste. Good morning.
Namaste, Sasha.
Good morning. Good morning.
How are you?
So good morning, my friends. Willie, can I ask a question, Sasha? Good morning. Willie just gave us a prominent update of Australia. How is the flat line looking right now? I mean, you really haven't experienced it. I mean,
Not yet.
It never have happened. But
not yet.
No. How close do you feel like you are with the flat line?
The health issue by itself looks like Canada has taken a grip on the situation pretty well. Although new cases are appearing every day, new deaths unfortunately, in very low digits numbers, but still they are there. So we didn't stop that, we didn't contain that, but I think we're on the right track. The more worrisome are news on the economic front. On the last survey, about 50% of Canadians are planning to declare bankruptcies. Just as simple as that. If it's relief or non-relief, the
Is that all? Did you say Americans or in Canada?
No, it's Canadian surveys.
Okay, Canadians.
Canadian.
Okay, so that's lower than I would have expected, given the way but Canadians must have a different practice of financial fitness.
Now, if you remember crisis of 2008, real estate bubble and mortgage collapse and everything else, Canada did relatively well. The Canadian banks, they had very sound lending policies, and they actually recovered much earlier than almost any other banks in the world. You see, in Canada, banking industry is very centralized. There are probably six, because National Bank is not that big, but let's see, arguably there are six big banks that are involved in lending money, mortgage and commercial lending and so on. So essentially we are talking about banks which are heavily regulated by Canadian Central Bank, and therefore they have sound lending policies. It's very difficult to initiate mortgage on a property unless you put at least 25% down, and so that they probably escaped a lot of things which were prevalent at that time in the United States. However, now situation is somewhat different. Although there are reliefs on its way, and Canadian government has pretty good policies about compensating people for everything that's happened, but I don't know, maybe that's because they're very liberal laws on personal bankruptcies. A lot of people probably, if they don't have real estate, or if real estate has lately happened, that, you know what, I have to investigate it a little bit further for myself, because Nick, just last week, he was praising real estate, and he was telling that real estate is so sound and great, and he's so busy. Now the latest information that I'm getting, and not only from Canada but US, and mostly US, is that mortgages and therefore real estate itself on the verge of collapsing. And I just try to figure out how to connect together what Nick was saying just a few days ago and what I'm hearing more and more in the last couple of days. I've got one publication here. Maybe it would be of interest. It's published yesterday. Did the Fed just accidentally trigger a housing market crash? By flooding the market with money, the Federal Reserve just accidentally pushed mortgage bankers to the brink of bankruptcy. The Federal Reserve just bought $250 billion of mortgage-backed securities in a bid to strengthen the markets. But the move caused a tsunami of margin calls across the mortgage banker industry. Some warned they could go bankrupt within days. Home buyers' demand has dried up, and millions of mortgage delinquencies loom. The Federal Reserve unloaded its bazooka of stimulus all over the markets in the last 2 weeks, but there is some major collateral damage. By flooding the market with money, they may accidentally trigger a housing market crash. The Mortgage Bankers Association (MBA) warned of large-scale disruption of the housing market and accused the Fed of using a sledgehammer. It's a standard practice across the industry and almost never causes any problem to hedge their mortgages until now. As part of coronavirus stimulus action, the Fed bought $250 billion worth of mortgage-based securities in space of 2 weeks. For perspective, that dwarfs the amount they bought during the housing crisis by $80 billion. By flooding the market with money, the Fed forced down rates. Problem is that just blew up the hedge. Mortgage bankers are now getting margin calls and need to pay tens of millions of dollars to meet them. Even well-capitalized lenders are on the brink of going under because of it. In a letter to regulators, the MBA wrote, margin calls on mortgage lenders. Margin calls on mortgage lenders reached staggering and unprecedented levels by the end of the week. For a significant number of lenders, many of which are well capitalized, these margin calls are eroding their working capital and threatening their ability to continue to operate. Housing market on the brink. This isn't the only seismic shock to the housing market since the start of the coronavirus pandemic. Home buying demand has all but evaporated in the last months. Year-on-year growth in the housing market slumped from 27% in January and February to 1% in March. Well, I think that's enough information of what really happened in the real world. So what's a scary thing about it is that, okay, the stock market fluctuates back and forth, and not majority of people probably don't even have any stock on it. But housing market, it was until recently was insulated for all those problems. However, unfortunately, it probably will be affected. I found it by a very curious way. I have a very, very small holdings in Arbor Holdings. It's a very well capitalized mortgage lenders company, which is paying before the crisis, their dividend was about 9%, if not more. Now it's paying sort of like 28% dividend. And the stock is, of course, down. It was $15. I bought it at about $9. Now it's down to $5. And I have very, very small holding. I'm not too worried about that. But I couldn't understand how this company could be in trouble because they're sitting on.
I think the audio quality is not good. There's some problem in the audio quality.
Hi, good evening, sir. How are you?
Hello? Namaste.
I think we lost him.
Okay. Sasha, this is, what you're talking about, and I'd like to know if this is a problem in other countries. Like Willie, is this been a big concern in Australia, or are you guys more concerned about flatlining? I mean, is there a concern about the financial side as much as the health side? Is there a balance there? Because Sasha brings up a good point.
What I'm seeing more is the health aspect. The financial, they do show pics of what most of the business closing, and outside of that, it's just more the health aspect of it. They had one small manufacturing factory that made masks, and now they've partnered with the military for the production of the masks because they just couldn't cope with the volume that they needed to make. And Yeah, that was really inspiring to watch. And the guy behind the owner, the CEO of the company, said, "We're not here to make millions of dollars. This is here to protect the doctors and the people in the front line from catching the disease."
Yeah, I mean, I think, and but the world, they're so scared of just all the other parts of it too. They're worried about their financial things. In Australia, you've already received your third stimulus.
Yes.
You guys took extreme measures earlier than us. We've been watching. I've been watching Australia just to see what's going to happen next. Can we discuss just a little bit before we move to our next guest as well? Is what exactly are the three stages that we're talking about? Willie, what are the three stages when you talk about this? What does that mean for viewers?
Uh, the three stages is more the congregation. So now it's down to two. So when you go out of your house, there's not to be more than two people in a group. There's no more group thing. There's just the maximum of two people. Previously, they had minimum 10. So the group scenario is just going down and down. So now it's two, and within a family setting, that's okay. The parents and the two kids, three kids in a family setting, that's okay. But outside of a family setting, there's just two.
Okay.
And the and the
So
police are in, and the police are enforcing the fines.
so the fines are very big.
Yes.
Are they still around 1,500?
Yes.
Because we get different reports here in the U.S. and someone said it was 1,000, someone said it was 1,600.
Yes.
I figured it was more like what you've been telling us, 1,500. I like round numbers anyway.
Yeah.
But it's easier to multiply. But
do they accept Canadian dollars?
that's right, the Canadian. So and we think about that. Are they putting people before profit? I look at other countries. The extreme measures you have been taking, like in India and Canada, Australia, has been people before profit. I'm not going to say anything about America right now because each state can't even agree on anything. We were still doing, mass people of 100 when they were saying only do 50 at the CDC. We now have a rule that people can't comprehend, which is one person per cart in a grocery store, or one person per cart in a supermarket kind of a situation. So, I am trying to understand why we haven't taken extreme measures. I don't think people should have been collateral in any situation, and I think we didn't take extreme measures soon enough in our country. Ankit, will you introduce our guest?
Yes, so today we have Shankar Sahai and Namaste, sir. Good
Namaste.
evening.
Namaste.
Very good evening to all of you. Namaste. I hope I'm audible to all of you.
Yes, you are.
Actually,
It's
it's
great to be part of
early for Willie, and it's April Fool's Day for Willie.
Great to be part of this panel.
Yes, thank you. Share about yourself. Who are you? What do you do?
Sure. I'm from India. I'm from Delhi, and I'm having around 29 years experience in different fields like retailing, academics, marketing, and I'm associated with a number of organizations. I would like to be a part of this panel discussion on a very important topic, which is the COVID or the coronavirus and its impact on our society, country, as well as the world. So that's a brief introduction. And uh, we were talking about, I think, the steps which are being taken by the different countries. And in that respect, I would just like to mention a few points. Yesterday, I was witness. I saw the discussion, and Nick was there. And I hope he would have been here today so that we could have discussed upon a few points. He was talking
I'm
about
trying to get him
US
on.
nation.
I'm trying to get him on.
Sure. So we were talking about a number of issues as to what governments are doing, each country. And I'm sure Ankit was mentioning yesterday as to how our Prime Minister he has become a kind of an example all over the world by enforcing the 21-day lockdown. And he said it recently. He said that I'm very sorry in case people are they are facing inconvenience, which they are. But at the same point of time, it is very important. So, of course, when Nick will be coming and discussing one of the points that he raised yesterday. But I would just like to mention one thing. One of my friend's son is studying in New York, and he was there. He enrolled last year, and when this disease broke out, then the hostel was closed, the institute was closed, and there was obviously when they are closed, then he has got no other place to go to. So he took the flight and he came back to India. And similarly, there are a lot of students who are having a kind of an exchange program with the different universities in the US. And it's very simple. They feel that as on date, their future is in the dark. They don't know what to do. So, is US or the institutes or the universities, apart from the online classes part of it, definitely is a way out. Uh, are there any steps being taken by them to help these students? Because I'm sure all of you will be agreeing that the foreign education is like a bomb. And if after spending all that money, the students or their parents feel that we don't know what will happen, then it's a tricky situation for them. So, is anything being done from the government side or from the institute side to help the students?
So
I,
there is stimulus written in the US. I don't know how they do stimuluses in other countries. But we are going to do a review on it. If you register with Nick, Nick, at IBM.TV, they will be hosting a webinar for free, global
Okay.
webinar if you want to. It will be April 8th, I think 1 o'clock in the afternoon, because that's when he usually has an open window. But to understand a bill that is written by our government is very lengthy in detail. There's a lot of compromising going on. I've been trying to read through it myself, but it was 890 pages.
Wow.
Yeah. So where you should say we're just going to take care of people. No, they define everything down to we're going to allocate $347 million for evacuation. My question is, who's evacuating right now? We should be in lockdown. We're setting aside $347 million for the Peace Corps. Well, this is not a situation, I think, where the Peace Corps needs to be funded. We just need to get food to people and make sure they're comfortable and not panicking, and get people healed. Now, if the Peace Corps is sending in their people and their doctors and their resources to help the hospitals and doctors and stuff like that, I understand that. So there is a small section for students. And so this is a good question to ask Nick. Nick has a lot of people reading this, but this is what I want people to think about is right now we need to focus on getting healthy and supporting the hospitals, the labs, and every one of these people in not just developing to flatline the infectious rate curve, but also to prevent it from spiking back up again anywhere in the world. And right now we have countries that are very, very small that are not going to be getting the help they needed, and they'll become heavily infected and maybe respread it to other parts of the world if we're not careful. So we need to be smart about this and say, profit. And this is what Ankit and I talk about. What's more important, people or profit? Unfortunately, that scale needs to be balanced because people are not going to move forward to do. Some people are not going to move forward to do things unless they make a profit. And we saw this with HIV. We saw this with other diseases that infect people, like our inhalers. Our inhalers went astronomically high a few years ago to the point that people who needed them could not afford them. I know people who order them from Mexico right now. So, we just have to be smart, right, and humble, and
Certainly.
and get back to that humbleness. And I don't think America really thought this forward enough, because our infectious rate is still very, very, it's going to go higher because people don't realize that our stats that we see today are from tests 10 days ago. So we haven't even come close to the peak because we haven't even seen what next week's stats are going to be from this week. So until we get the rapid tests out there that really work, if they really work, and we put an official lockdown, we're not going to be able. And I think, thinking about the financial impacts, that's something we should be doing while we're at home. Get financially fit, do your books, prepare your taxes. That's a big thing here in America this month, but they put it off to July. But be considerate about other people. Think about what the CDC and the WHO are saying. Learn about this disease. Not one person in the media has shared, other than Dr. Yu and a couple of doctors who've come on here, nobody's really shared what the damage is to the human body when this is done after you've been infected. And that's concerning to me, because it's a spiky thing that gets in your body and tears holes in your body. Nobody talks about this. Nobody talks about how to heal from it, or if you will be healed from it. Will we have to take medication the rest of our lives to be able to breathe better? So I think the right information, I think WHO and CDC need to step up to the ladder and start educating people a little bit better. These are our world resources, and they're not doing their job. And I think that's the thing. I want to talk about the finances. I want to get Nick on here and talk about that too. But I think as a financial person, maybe that's where our investment of our money needs to go to, is a real World Health Organization that is really responsible to making sure we all get the same message and we all follow the same policies. Yes, Sasha.
Kim, I've seen yesterday a Russian talk show, and they've confirmed that, and it applies both to older people and younger people, 90% of the people who recovered from COVID-19, they have permanent damage to their lungs. And it would take years for them to heal it, and it's a best case scenario. Some people will never will be able to heal from it completely. That makes it so dangerous.
When you've got something that looks like this going into your body and tearing holes in your lungs until they look like a honeycomb. I mean, look at all those, that's what it's spiky all over. It's a spiky ball, basically. And it's, so to me, those are the things we need to be investing in. And how do we heal from it? Is there a way we can heal faster? Because of the permanent damage. And this was not the information they were giving us when they learned that this was happening in China. Nobody was telling anyone about the permanent damages. They were leading us to believe warmer climates would be safer. That's no. They were leading us, younger people can't get it. No, it was their immune system. So we got to get the real message And somebody needs to be accountable for that real message. And we need to invest in those people, the people who really care and care about getting the real message out there. Why wasn't a memo sent to the world from WHO and I think this was the question the doctors were really hitting on us about yesterday. Why don't we have a policy in place globally when something like this happens? And why didn't everybody take the same the same measures? Because we didn't. Every country should have locked down immediately when this happened.
I agree with that. I agree with that.
And Kit.
So
Yes.
I would like to first
I think
answer Shankar sir's question that he was asking that what happened to those students who are studying abroad and what happened to those parents who have paid a lot of money for the students. So for them, government is doing a lot of programs. The first program is they're extended their visas based on their curriculum and based on their requirements. And also, if you are following the H1 program as well, so the government is planning to raise around 180 more days for people, and they can work them there as well. Because the airlines will not be working for next 6 months, no, as compared to the normal airlines what they used to do. And moreover, all the international universities who term themselves as international universities, they are teaching everything online. So I think students don't have that much of problem. It's just that they can't use the infrastructure as compared to the physical infrastructure they were using. But they have a lot of digital means, and a lot of teachers are available and doing a lot of good stuff. So I think that portion is not that alarming. My concern was that people or students who are stuck in the universities, what happened to those students? Because a lot of students around the world, they are stuck in those universities and they don't know how to move forward because
So
the
I,
airline is working and they don't have anyone in that particular state or city. So what's happening to those students as far as their health is concerned? And second of all, when we talk about finances and all those things, so when a government plan their finance, Shankar sir, I think he'll answer this question that what are the main points or main categories or terms or modules they think before doing it. Can you just name 3 4 items? What is the budget they plan to start? Shankar?
Ankit, I don't think I'll be able to answer from the government side, but as far as the institute is concerned, there is an MOU between any two universities or institutes. Then things come into mind, and like suppose the exchange program is there. Now, say a semester exchange program is there. The students have gone to any other country. Then it is the both the countries they are in touch with each other. And of course, as on date, if there is lockdown in a particular country, then that takes care of the student safety. But the point which I was making was I'll give another example. In Germany, the institutes, universities are closed.
Yeah.
They have said that online will give you the course material, everything is perfectly fine. But along with the education part, they are having something which is an industry exposure. And by way of that, say one student goes to a company or goes to a particular firm, and that firm says that you have to report to the office because lockdown is not there. That student he is in a foreign land and he's exposed to a lot of danger as far as the virus is concerned because Germany, as we all know, it is like a catastrophic situation as on date. So in that kind of a situation, can the government step in or can the institute take a stand? Because the firm is outside the purview of the institute. It's like a kind of an internship. In that kind of a situation, can the government step in or can the institute take action?
So I think to answer this question, I think those students who are stuck and they are looking for help, they can reach out to the nearby embassies, and I think the embassies people are helping each other. I'll give you a small example. You are also when you talk about Germany, the France is the neighboring country to Germany. And a lot
Right.
of COVID
Right.
patients are shifting from Germany, from France to Germany for treatment.
Certainly.
I think we need to reach out to our resources like the embassies. If somebody has need for help and they're watching our show, they can reach out to us and we will try. I cannot promise 100% results, but we actually have contacts all over the world in some weird way. You know how everybody's network reaches out another step. So, and we actually had somebody reach out yesterday about a family member. So, we're going to try to do what we can to help
Right.
and become a resource, a reliable resource. But at the end of the day, but some countries, maybe the people they don't feel trust yet with their embassies. But I would say reach out as a student, reach out to your embassy. I hope
I
they
think
trust us.
that's the right channel to reach out to the embassies, basically.
And I hope the universities took
Certainly.
a step towards, okay, if you can't get home, this is what we're going to do for you, because they actually emptied all of the university dorms from fear that they would contaminate each other really fast. So they sent as many children home as
I think
possible. But what do
some
you
audio
do?
issues in between.
Excuse me?
There was some audio issue in between, I think. I couldn't hear the last sentence that you said.
Oh, I think that they were sending home or sending all the students out. For the ones who could not make it home, I would hope that they had made arrangements for them somewhere. We're just going to see what happens. I mean, everybody in the world is alerted to this. I received messages from Afghanistan. I received messages from little bitty countries. I'm sure Ankit's getting them as well. And so this is a world problem. This isn't just one country, one state. And I don't think people really understood the impact of this virus. Like you were saying, it's everywhere, and anyone can get this. And then we need to take a look at what happened to our financial situation. And fortunately, we have people who are doing that, who are staying at home, and they have that ability, like yourself, to take a look at what's going on. How's the economy going to be impacted? But how can we help everyone, not just yourself? And I think those are the people I'm going to be looking at, are the people who are saying, how can everyone be helped? Because certainly a lot of people benefited when the stock dropped, because you have people who bet against the stock and they knew how to do this.
Right.
So there were a lot of people who made mega millions, if not billions, a few weeks ago because they knew how to bet against it. There were other people who bet against what I call the middle between the floor and the ceiling. It's like a trampoline. I took the class about a year ago on how to do this, just to understand it. I never understood it enough to feel comfortable enough to do it myself. But I do know that there are people who will make a lot of money when it drops, as well as when it goes back up, because they'll know how to reinvest it when it goes back up. And that's called buying. I call it buying between the trampoline, ceiling, and floor, right? Jumping up and down. It jumps up and down in the middle, and you know how to buy in that bounce. But I think right now what we need to be focused on is kind of like what India is doing. They're making sure everybody is taken care of. They're not financially scared. They're trusting their government to guide them through this. So they're not thinking about their financial welfare right now. I'm sure that's in the back of their mind. What am I going to do tomorrow when this is over? I don't think this is going to be over in 21 days.
True.
Absolutely.
Completely agree.
I'm sorry, but I 100% disagree with my president. I don't know why he would get up there and say 21 days. Sounds like that. There's a movie called 21 Days. It's a zombie movie. I think somebody was predicting this, but I think we need to be smart and realistic and tell our people, inform them honestly. This is what's really going to happen, but we're not going to just let you drown financially. I overheard a conversation. I'm keeping my distance from people, but I overheard a conversation where somebody said, "Yeah, our rent just went up, a couple $100 a month." I go, "Why would a rental place go up on their rent right now? Why?" And it's because nobody can go anywhere. So that's capitalizing on people's losses, and that's wrong. No rent should be going up right now. It's just, but that particular place decided to jack their rent up and cost their people more money. So I don't know, and I don't know what people are doing, if the government is controlling that in any way or sort. Ankit, what about your country? Have you heard about anything like this?
So the government is supporting so as the state government, and also we have a lot of packages from different ministries and different state government, and people are also coming forward and donating a lot of money. But the problem, what we have discussed earlier, is that if 1% or not maybe 1%, if thousands of people are on roads and they're not obeying the rules, the lockdown, we are still in a bad shape because those people can spread viruses.
That's right.
And and when we talk about 21 days, I mean, I don't think the 21 days would make anything different. But 21 days can show you a picture that what is your peak,
That's
because
right.
then also you have to. So it's clear that all the countries have to reach out to a peak, whatever the peak they have, and they have to slowly go down. So we have to realize that what is our peak and how we can slowly move down. That is what we are trying to analyze. And from past 2 to 3 days, we are also growing with a lot of numbers because the tests are going on, and then we are getting the reports, and then we are, giving them the right medication. So we are also growing with numbers as and when the days are progressing. But we are locked down since 7 days by the government, and voluntary people are locked down from past 10, 14 days. And still we are struggling with a lot of things because we are 1 billion people and it's difficult for everyone to manage. People are migrating from metro cities to their villages, and they are going with different modes of transport because the public transport is not available. So they have different
Mhm.
ways to move around. And a lot of emergencies also going around because that's what I was discussing. And and also we as Indians or maybe around the world, we have realized that now while we are locked down, we are not concerned about our cars, we are not concerned about our bank account, we are not concerned about our clothes, we don't have anything to show off. We are just sitting at home, eating whatever we have, and still doing our best and living a good life. So that means it's all have been created and done by people like us. And if you can see outside today, the sky is beautiful. You can see birds are roaming around. You can see birds are, you can see the squirrel, and everything is back to shape. So it's like a reboot of things going around, and we have to take things positively. And I think it's about working together with joining hands around the world. It's not that India will do something and then some country will do something else, and so we are not on a common platform. That's what we are discussing, and that is what we can do. So I think there's a lot more to be done, and we are just waiting and waiting for the right time, and things will go based on whatever the case study, the best practices we have from around the world. But it's difficult for us at IBM and for other people as well to just look at the stats and checking that how many deaths are there and how many new cases are there. I am very fed up and while doing all these things because I don't know. I mean, why? Those stats make you crazy. That we are growing nowadays. We have around 100,000 people with new cases every day, and thousands of people
And
are dying every day. And so I don't know. And governments are not reporting well. We have different data from different countries, so it's a difficult situation. What do you have to share with us?
so, Ankit, you make an excellent point there. And again, you have to remember that it's still going to go up. We're going to still
Yeah,
see it go up because the test results are still 10 days behind. So you're going to have to at least before you see that. But if you can look and see this picture, I'm not going to play the video, but the
yeah,
traffic is going to Florida. This is from New York. This is I-95,
I
or
know.
I think, But anyway, it's traffic going from New York on the highway system all the way down to Florida. Now we're talking thousands of miles, right? But and it's a long drive. But this is what it looks like from New York to Florida, because there are still people who believe whatever was told 14 days ago. That's when they turn their news off. And they believe that warmer climates make a difference. They also, for some stupid reason, believe that there's enough beds in Florida. And there's not. There's not enough beds in Florida. So we need to be smart about this. People need to re-engage in looking at CDC reports and be smart about it. Now, they put roadblocks in Georgia to redirect the traffic, unless I guess you can prove you have a home in Florida. They're definitely not going to let you down there. So, but but you can see the difference in the road where the traffic's all going one way, right? There's very little traffic going the other way. And again, I think people need to get smart about this. This is not about the warmer climate, except for maybe your healthier lifestyle. Your immunity system is probably better. But people are fleeing New York as hard, as fast as they can. And I think that's just going to cause another problem, because you got to stop to get gas. You got to stop to eat. You got to stop to rest, to go to the bathroom. I mean, there's a million places that you're going to stop and touch things that millions of people just touch. And I'm not a big fan of the takeout food unless you just have to have it. Unless you are a person who that's all you've ever relied on in your life. But I think takeout food can be contaminated too. So, I mean, and you are contagious at the moment of being infected, the moment, not when you get a fever, but the moment you become infected. So you have no idea. So is this me still sharing? Sorry. Look at that though. That's all the spikes. Just like this stupid ball, right?
Yeah.
Those are all sharp spikes. Look at that. What? It's scary. I don't want that thing in me. But let's talk a little bit positive about getting to that flat line. Oh, Ray, Dr. Tula.
Hi guys, how
Welcome.
How Kimberly? Mac, hi my dear friend Sasha, how are you doing? And dear friend Ankit, all's well?
And
All good,
Willie,
sir. All good. Following your guidelines
Good.
and taking the right care.
Okay, good. That's very good.
how are you feeling today, Dr. Tula?
Yeah, much better. I'm sorry, I took a hiatus yesterday because there were some grocery work also to be done.
Okay. That's
Well, we
also
all
very
need to rest.
I didn't get you.
We all need to rest.
I said that's also very important.
Yeah.
So I was watching interviews with people, and Kid, I think, was sharing it with me, but they have been inducing a lot of the people that are infected. They've been incubating them, what they call incubation period. They've been putting them to sleep, and that's so that their body will rest, because while your mind's awake and you have fear, your body can't rest and heal. And so they've been putting them into a drug-induced coma to force them to sleep, rest, so that they can recover from the virus itself. We've heard stories that it's very painful. It's like breathing glass in your lungs. So, of course, if you're in that much pain, you're not going to rest and heal. So, hearing the stories from the people, I think, will give other people a reason to stay home. And definitely distance yourself. If a member of your family has it, start taking in-home distancing practices, right? And it also help them heal. We've heard that humidifiers are really, really good for them. Get them into a steamy bath. And help them through the healing process the best you can, but also protect yourself. And I know it's very hard in a loved one situation to watch someone have such a horrifying disease or virus and not be able to touch or help them. But hopefully people will learn to put on a mask. If they have it, they will learn to wipe their surfaces down. They will use their elbows as much as possible, or do like I do, start opening all your doors so that you don't have to open or close them. But we're at a point where many people have this. Yeah, there you go, Ankit. Ankit's got his. I keep a stockpile. And I like this, but I don't wear this very often unless I'm in, around sawing wood or plaster or something like that. But there you go. That's right. Wear a mask and protect the other people in your household, not just yourself. But I think we need to start putting people before profit. But while you're at home, don't sit around watching TV, right?
Yeah.
While you're at home, do some financial stuff. Do exercising. I mean, how often do I hear people go, I would exercise if I could be home more, but I have to be at work. Well, all right. I'm going to challenge you. Let's see who can exercise the most. I have a friend and she's 25,000 steps a day. She put on her Fitbit and she's doing 25,000 steps a day. Wow. Yeah.
That's great.
And that's just her house. So I think these are the things we need to start doing, get your body in shape. There are some great simple exercises we could do at home. Prayer, get back to our roots and pray. Use the phone. Call your friends and family. Check up on them. I remembered yesterday there are people that are elderly that need my care. But Willie, let's talk about what are you doing in Australia? You just wrapped up your job, didn't you?
Yes. So today's I'm officially off now, so I've got more time for IBMTV. One of the sad things I saw on the news last night was foreigners in Australia. They have contacted the embassy of the countries that they come from, but the country is more concerned with the local. There was a girl from Ireland. She's here on a backpackers, like during summer, we get a lot of backpackers. So the country is more focused on helping the residents in the country, she's from Ireland, and she says she's not getting help. The hostel that she was staying in was closed down, so she doesn't have that. She's unable to get work, and just all around, everything just not working for her. So what I'm doing is I used to do volunteer work for the Sacred Heart Mission in the kitchen, so I'm just looking if there's something that I can do to help people in that scenario within Melbourne, sort of give them pointers of places to go to.
Really, can we do something?
That would be awesome.
Can we collect some data around the world and share it with the world? Because there are a lot of data which is not shared by people around the world of COVID.
Yes.
And we can do something on AI based on that, because people have different symptoms around the world. I think Dr. Kula would have said there are a lot of different symptoms around the world, and people are still trying to figure out what's the best way forward. Dr. Zula, can we do something where we can collect the data and symptoms and then we can capture it?
Yes, we can. The problem now is that you need to understand one thing, Ankit, that maximum people have very soft symptoms.
Yeah.
They're virtually asymptomatic.
Yeah.
This is the tragedy with this disease, that you don't know who could be a carrier. So unless and until you do testing, you will never come to know exactly who's the carrier. And the problem has
Absolutely.
been like that has been the biggest pitfall in in trying to take care of this disease, because if you look at the history of all the people who have basically been super spreaders, they have all been asymptomatic carriers. They did not have any fever, so they got they were taken off. They skipped that thermal scanning which was being done because they did not have any fever. They did not have any cough or anything or any symptoms which were suggestive of coronavirus. So that is the biggest challenge, because people who have good immunity may not contact, show symptoms of the disease.
Okay. Okay.
But can we still collect some kind of a data which would be helpful maybe for later on? I mean, because vaccine
Yeah,
will
so
take
we
around.
can, but provided so we can, provided that the governments are willing to share data. My only concern now is that, see, every government is, playing to the masses, or I would say playing to the gallery of their,
Yes.
constituents.
Yeah,
So virtually,
absolutely.
are they really sharing the entire data? That is a big question mark. I mean, which is there in the various countries.
Absolutely.
That's what we are feeling
And
So
that we are.
how do we, so,
you
so how
remind
do
us of
we,
something very
judge the
important.
authenticity of the data? Because people like
Absolutely.
Billy can, there are people who are data persons, but they need the right kind of data to be, I mean,
Absolutely.
to get an conclusion out of. So that is the
Yes.
biggest challenge now.
Yes.
Okay.
That is
So
the big challenge, to isolate, to contain, to flatline the infectious. And you keep reminding us, and I wish people would listen. You don't know you have it when you have it.
true.
There's no symptoms on the day you become contagious. So Willie, you got something
Maybe
to say?
Yeah, true. So what I'm going to do is just gather and build a template saying, okay, if you're in a foreign country and everything's closed down around you, um, look for these charitable organizations that can take people on, and and sort of addresses, or so that at least they can get to places that still have like open doors in a charitable setting. Um, I'll have to sort of do some searches and find out more about that.
that will be wonderful. That's a very good initiative.
Yeah, because
I think that's a good idea.
Right.
Yeah.
That's a
just
good
think,
idea. Also, maybe have some little criteria. How long have you been self-isolated?
yep,
And things like that. When was
yep,
the last time you traveled? Um, just ask some criteria
yep,
points, like they would ask me at the doctor's office.
Definitely.
They would ask me, "Do you have muscle pains, fever? When did you get back from China?" Those kind of questions. But
But do you think people will
but
share the right information? Because that is what the problem is. A lot of
So that,
people are not sharing the right information, and that's why we are having so much
yes,
of trouble.
that is why the challenge has been, and especially in India, I would
Yeah.
completely agree with Ankit that the problem has been that the people have withheld information for various reasons.
But sir, it's
There
not
may
about
be
India.
they have their own. All across, I presume now.
Yeah, but especially in USA, I mean, people are not sharing the right data, and then they are flying from here to there, and especially people are coming out from New York and going to different states, especially Florida. So I think it's not about India, but overall, I mean, people are not sharing the right data, and that's why we are facing so much of issue and so much of spread is going around, because it started from one country and now it's almost spread it to around 200 countries. So I was checking one more data which says that every day around 5-10 countries are also adding up due to this, and we are not learning from our mistakes which have been done by different countries at different point of time. And also that is what I mean. If we ask them to share the information, I'm not sure whether I'll get the right information from everyone. So, I mean, if we have some validation or something which we can do it, that would make things more easier. And also, I'm not sure whether embassies are also sharing the information with different embassies that who have been traveling and who have come and visited India and all. Because in India, we have found a lot of foreigners roaming around in different states and cities across India at this point of time. And police are capturing those people, and we are not sure whether they have COVID symptoms or not, but they are moving like anything. So it's not about what we can offer or what we can ask for them, but how we can validate those information. That is more important.
So, Ankit, my question is that if the people, I mean, I'm talking about the foreigners who are in our country, normally what happens is that they have to report to the police station after their visa expires or something. So, they must be on the traveler's visa, I presume.
Yeah.
So, what is happening to them then? Are they reporting back, or are they also gone into some kind of hiding and people are hiding them inside?
You know that everyone has the reason that no one is working, and that's why they are not able to reach out to the right person, and they are also using the time to safeguard themselves or maybe whatever their objectives are, so they're fulfilling those objectives because everyone whoever is outside their home, they are either helping themselves or they're helping each other to fight with COVID, or people are taking their chances and doing a lot of stuff. Have you heard about a story from Italy that it's a disaster going on, and still there are a lot of thieves, and they are they are taking a lot of ancestral and photographs and all things, and they're capturing that from museums.
My God, that is atrociously. I mean, there is something. It seems that there is something atrociously, I mean, wrong with the psyche of the people. Then, I mean, you
That is
can't
what.
have.
So
I mean,
everyone is, yeah. So people are basically doing whatever they can do. There is one more thing going on in India, that people are sending you messages that we have a solution for COVID, or we would like to test you for COVID. We are from this department, and if you click on that link, they will ask you a number or something, and then they'll capture your wallet. That is also going on.
I mean, this is.
Yes, there have been cases like that.
Yeah. So, sir, we have to be very sure, because we can't be the third person that we are asking information from a lot of people, and those information are not genuine. Those people think that we are thief, and we are thinking they are not sharing the right information.
Okay.
So there should be a quality control and a quality check, and only once we validate something, then only we can move forward. Because otherwise, that information will also be displayed like the other information we have. Sir, Dr. Tula, I would like to ask you one question. Before that,
Yeah.
I'll share the
I'm going
ventilator.
to step aside because we have another guest. I'm going to step aside so you guys can have a big panel with the other guest.
You need to see this video. I'm just sharing a video, right? And the guest
Okay.
is on a wait right now, so he messaged me that he wait for it. Just a moment. So this is the ventilator what India have produced in 48 hours. Can you see the pictures?
Yes. Yeah.
Right.
So Kim, this is done by one of our industrialist Mahindra Group, and the cost of this ventilator is around $100. So I'll just start the demo.
New bag. Ambu bag is currently being used by medical practitioners in case of emergency by operating it manually. As the pressing is manually done, it cannot be sustained for longer duration. And also in the current circumstances, distancing from the patient is very much necessary. So we have motorized the pressing operation with all the necessary controls. Let me explain you the key feature of this device. Let me start this device. So the rate of air pumping is controlled with the help of the speed control switch, which we have provided. So there's a potentiometer which controls the RPM of the motor. You can see as we rotate the knob, the speed is getting increased, and we can achieve 0 to 30 breaths per minute. There's a provision to control the volume of the air being pumped. So we have provided two settings on the switch. Thereby, we can achieve two different volume levels, volume of air going into the patient. There's a pressure relief valve provided as part of the MBU bag kit, which releases the pressure if it goes above 40 millimeters of mercury. We have provided an emergency stop button on the console. So in case of an emergency, you can stop this device. There's an additional handheld pendant device provided especially for the patient, along with a long cable. So in case of, and we have provided an emergency stop button on that pendant also. And also there's a doctor's call button for ease of the patient. There's an inbuilt logic in this device. So if due to some reason this machine stops, then there will be an alarm for the attendant or the doctor to come and attend the patient. In that case, this MB bike can be operated manually. For making this device, we have used all the standard off-the-shelf parts so as to ensure reliability and durability of this device. Thank you.
Wow. Are those are available now?
Yeah, those are available now, but right now they are doing it for Government of India, and then maybe they'll supply it to other countries. I'm not sure about that.
So let me ask you this. Could we take the blueprint and the bill of material and manufacture, hand off the manufacturing to other facilities around the world as opposed to just distributing from one plant? Would they be willing to share the drawings?
I have never, heard those stories that these companies are ready to share their formulations and the manufacturing process. But maybe, if the situation is go out of control, so maybe they'll do something. But it's a big, one of the biggest groups in India. So I think they can handle those ventilators and they can manufacture it whatever time required or whatever units required. So,
And
So it's only
another thing is,
yes, sir.
another thing is that what they are doing is they are utilizing their automobile manufacturing facilities for manufacturing these kinds of ventilators, because it was in the news that they are using those facilities. So they are themselves quite positive about using them for the benefit of which is the crisis as on date, rather than the automobile part of it. So from their own side, they are very positive.
I think also these are not completely
That's
ventilators.
interesting.
You can replace ventilators with this thing, but for COVID, because people require a lot of respiratory issues, so I think for that purpose, these machines can be used. What do you think, Dr. Tula? Is it?
Yeah, Ankit, I would second you on that. That I mean, for an emergency kind of a scenario, this looks like a very, crude copy of a ventilator, because exactly it's not a ventilator to say to that the hilt, because what it is doing is it's using the basic manual pumping action of the umbo bag only, right? So it's basically a kind of machine which is banking on.
Okay, so if you need distribution, if they need help with distribution, maybe we can help do that. I understand taking care of yourself first. We are trying to supposedly build ventilators with our car dealerships. That has been the rumor for 3 weeks, because they have the machinery to build them. But a ventilator like what I just saw could easily be built in other manufacturing facilities. It's just a matter of bill of material of being able to put it together. It looked like it was hand controlled. Am I correct that it's mostly? Yeah.
So I think
It's amazing what people are coming up with these things. This is amazing, innovative. I'm going to step aside so that you can have the other people on.
Sure. So I think Dr. Vishal was waiting and then he left now, so maybe he'll join later. So
okay.
So back to the ventilator. So I have a question for Dr. Tula that, sir, whenever a patient is using a ventilator, and when the patient is shifted from ventilator to the regular ICU, so can the other patient use the same ventilator, or you have some kind of a practice where you wash everything and beforehand and then?
No, so the ventilator doesn't need to be washed. It is basically you see that there is a lot of tubing attached with the ventilator, right?
Yeah.
So that tubing is basically a kind of it is a very fresh So it is basically the tubing is made of, it's a kind of plastic which is there, and generally it is ethylene trioxide gas sterilized. So
Okay.
you don't need to do anything with the ventilator, because the ventilator, if you look at a ventilator, you will see that there is a it's only a device. Ultimately, the whole tubing circuit is changed after when you're going to put it on a new person. So apparently, contamination of the ventilator does not happen.
But sir, we have heard a lot of stories that whenever patient is in ICU, there are a lot of bacteria flows around in the
Yes.
ICU.
So that is because of the aerosols. That means that you see it is a contained environment, and of course there are all kinds of patients in the ICU. So that means that some will have some kind of bacterial infections, some will have viral infections, some are, and the immunity is also very poor in these patients, because generally anyone who goes to an ICU for medical reasons will not have the best of immunity. And plus what happens is that see, the staff is also going in out, and many a times people are not adhering to the universal guidelines also. So that is why chances of infection within an ICU is, what is known as a hospital-borne infection is, always going to be there. Plus, what happens in certain, if it's not a very high intensity ICU, sometimes patients' attendants are also allowed, and the kind of gown and the mask which they wear, they also take it little casually. So these are all things which do happen, especially in public hospitals. I'm not talking about private hospitals per se, but in public hospitals, due to various reasons, the universal guidelines all times are not adhered to. So apparently, one should avoid. God forbid, one should not land up in the ICU, and also should avoid going to the ICU.
Okay. And so that was the ventilator what we are trying to showcase from India. And Willie and Sasha, do you have any stories about ventilators in your country, and how are they placed right now? Do you have enough ventilators for people who are suffering from COVID-19?
Mm, not really. I know generally the trends and the stories, but I don't. I can't share any real example of what's really happening with that.
Willie, do you have anything
Yeah,
about?
same here. I have yet to see any Australian
So,
cases with a ventilator
so,
using ventilators.
so Ankit, I will add on to one thing more. I was yesterday going through one of these people who were doing innovations in these ventilators, and some gentleman had a very novel idea. So what they did was that the tubing which connects to a single ventilator, they got
Yeah,
into a multi-channel tubing, where basically you can connect four patients to a single ventilator.
wow. That's nice. Sir.
So that is also something which is very innovative, and I'm sure, people will use the great Indian jugaad, which people
Yeah,
will, use their own brains and try, because see, we need to understand in US everything is more, it works in a very different manner. So it is very process oriented, right? So ultimately, if they have a process, they will follow the process, without questioning the process. Indians, on the other hand, they are very inquisitive type.
yeah,
Can I
So
ask
they
you a
will,
question? I'm
yeah,
curious about that, Dr. Tula. Now, I
yeah.
mean, to hear that more than one person can use the ventilator, can that happen at the same time?
Yes,
yeah.
ma'am, that was it was going around. So they had the tubing. So basically, the tubing was made into four parts. So so this is what I mean. It looks theoretical at the moment. I don't. They didn't demonstrate that, but in the near future, you might have to do. All these kinds of aberrations from normal, because these are extraordinary circumstances, and you will have to think out of the box for doing that. See, you, in any case, you will never have, if God forbid this corona strikes in our parts of the world, we will never have the quantity of ventilators to take care of these kind of workload patients. So apparently, I think the world also has to take cognizance of there, and they have to start now innovating. Because if you're thinking of building a, I mean uh, incubate, a machine, it's going to take time. It's not going to happen in a day or two, or, I mean,
Absolutely.
So can
I
we,
agree. And, you know,
can
if
we
we
also
could
do
learn,
ventilation incubation where we put around 4, 5, or 6 patients together and then we incubate the complete room through a ventilation? Because ventilation is more about
that
giving them
that
power
is
to
that is not, that doesn't look possible, because please understand, this is basically positive pressure ventilation which you are giving. So the
Okay.
machine is basically taking over your breathing.
Yes.
So it's not like a bariatric chamber, or there is
Okay.
some kind of hyperbaric chamber where oxygen is just only going to be pumped in. So
Okay.
your breathing is also being dependent upon the machine.
Yep.
And then the challenge is that you need to understand that even if you have poor kind of, let's presume that I'm just assuming that we have a machine which we can be connected to 4 patients, their breathing and everything will be different. So you will have to basically segregate like-kinded patients for that similar ventilator. It's not going to be easy. The most important thing right now is, leave aside the ventilators, we need to understand that there are very few people who know how to operate these ventilators also.
Oh.
So that is going to be this is what is the challenge in US and all and Spain and France and in Italy, because see, in India and all across in all countries, so these are the intensivists who are the trained people to handle ventilators.
so what you're saying is there's an instruction book and a training that comes with the ventilators. We don't just need to be self-treating with them if we have the money to buy one, which,
No,
you know,
you will not be. You will not be able to. You need a specialist to, put you on the ventilator also.
Exactly. But we have people in our country who would buy them and use them on themselves without.
Yeah, so there was this story going around in Delhi also, that one of these high-end societies was thinking of procuring a ventilator. I don't know how true it was, but it was going around in circles. And the problem is that even if you buy a ventilator, who's going to use it for you?
How will
You need to have a specific doctor for that. It's not that I can use a ventilator.
Nick will tell you. Nick just joined us, folks. I want you to welcome Nick. I'm going to dive out so Nick can come because a few of you wanted Nick. And I'm going to and then we've got Dr. Vishal as well. But let me get Nick on and I'm going to dive out and let you guys talk to Nick a minute. That's an awesome conversation, though. Let's keep that one up.
Oh, hello. Yeah, we're gonna switch. Can you guys hear me?
Hi, Nick, how are you?
Yes.
I am doing fine. We're going to switch immediately to the financial issues revolving around.
I have to introduce Dr. Vishal. So we have Dr. Vishal with us.
Okay.
And, Vishal, can you hear us?
Dr. Vishal.
I think we lost.
Well, it depends what specialties and depends on whether he's going to be around. Oh, that Sasha joined us. Okay. Well, the market is up barely, like 62 points. But again, like I said, my feeling is, and this is going to last a long time, and it's going to have an adverse effect on everybody's bottom line in the next 8 to 9 months. So even though the market's up a little bit right now, it's going to face a major crash the next 2 months. When I say major, look at the Dow at 12,000 or 15,000, seriously. And no turnaround until October, maybe, and those are the harsh realities of what we're looking at right now, unless we get that vaccine. So the thing is, my question to the medical professionals that are out there, when's this vaccine coming? We're waiting.
So there was this. I just wanted to, before I answer that question, I wanted a quick one from you. How is the J&J stock doing?
The which stock?
The J&J. Johnson and Johnson.
Oh yeah. Oh, Johnson and Johnson. Oh, they're doing good. Well, if you're in so
the pharmaceuticals are doing well now, I presume.
Of course, yes. If you're in pharmaceuticals, if you're in health, if you're in health and technology, you're doing okay. If you're in transportation and retail restaurants, you are getting hammered. And not only that, the thing is, the hammer, you haven't seen anything like it. It's going to get worse, and everybody thinks it's bad now. Okay, but leaders don't want to tell you that. They don't want to say, well, guys, this is going to be around for 8 to 9 months. In other words, this is the realities. Look till next year. In other words, January, before you get anything close to normal patterns. Okay, who wants to say that? I mean, if you're a politician, who wants to say that this thing you're going to get hammered for 8 to 9 months? No one wants to say it because it's very unpopular. Okay, but that's the new reality of this situation, unless we get that vaccine. So, Dr. Tola, how's the vaccine doing?
So I read a article on the vaccine from there was a statement given out by J&J. They
Yeah.
did not name the month, but they have committed that they are working on the vaccine, and most probably they're thinking that they will be able to do in this year itself. Now, how true it is, it's very difficult to say at the moment, because there is a lot of speculation going around with the vaccines. All the major pharma giants are on it. Pfizer is on it. J&J is on it. I mean, so you name all the giants are on it.
Right.
So ultimately, there is China also on it. Now, how true it is?
Okay.
I mean,
oh, it's
and
great.
where at what
it's
stage are we looking?
Okay, look. I just need one vaccine. I don't need everybody on it. I need one to come through.
See, Nick, the problem is we need to understand that. I mean, see, you can have a vaccine, but you do have to remember one thing, that the viral diseases don't stay the same.
Mm-hmm.
They have a propensity to jump from one prototype to another prototype. They mutate very fast.
No way.
So,
okay.
So this is something which we need to understand, because Dr. Vishal also will agree that we had, the influenza shot vaccine also. It doesn't cover the entire prototype.
Yeah.
It covers. So we need to understand that. We are hoping that, this is going to be the last time we see corona, but that is hoping against hope.
Yeah, but the thing is, last thing in the world we need, Dr. Tola, is it to mutate again, because the thing is, this could go on forever. If you're telling me that, we bring the vaccine out, the bloody thing's going to mutate. Is that what you're trying to tell me?
No, I'm just trying to tell you that this is a theoretical risk which is always going to happen with all kinds of viruses.
Sure.
Irrespective of whatever we have. All viruses are known to do that. The problem right now is we need a good vaccine.
Right.
A good vaccine means that it gives us a very good fighting chance of, taking care of the virus.
Okay.
Because we need to understand that we cannot have a chance where we have a vaccine which shows maybe 50% or 60% coverage. Because then what happens to the 40% which it doesn't cover?
Okay. All right.
And honestly speaking, it will require a lot of time for trials and all. See, everything is going to be at this moment expedited.
Yeah, right.
The problem with expediting is that we don't know what exactly. This is just a throw of dice.
Okay. Well, okay. Since it's experimental, let's imagine this. Let's imagine that you gave 10,000 people the vaccine, but one of them died because you're really injecting, from what I understand, the virus into the person. One died out of 1,000. Is that an acceptable mortality?
So what vaccine does is increase the herd immunity.
In other words, because
the aim of vaccine is to increase the herd immunity.
Yeah, right. That's the whole idea.
The herd immunity at a level where you can control the infection. No, it is the aim of vaccine is not to treat everybody with vaccine.
Okay.
So what we do is we increase the herd immunity so that the infection rate, this is flatten the curve.
Okay.
Not get those number of people in the hospital with severe complications as you get without vaccine.
Yes.
So that is the role of the vaccine, but it's quite limited, I would say, with these kind of pandemics, which hit us very hard and very fast, and then they can disappear. Right. So what I need to stress is that this kind of pandemic needs to be fought at multiple levels. We need, number one, political consensus, which is we find lacking throughout the world. Our leaders are not saying the same thing.
Whoa.
If you hear the speeches of American president or the British prime minister or the French president or maybe from China or from India, they are very disparate. They're very diverse. They don't understand what is the basic problem.
Okay.
So we need to be on the same page politically
in
the country and as well as in the globe.
Okay.
Number two, we cannot shut down a country permanently just because we are having this pandemic. We need to understand that only we can flatten the curve. We cannot get rid of, we cannot come to a level where there is zero infection. Till then, we'll shut down the economy. Maybe it's American or French or the German economy. So the last we heard, there's a German finance minister who committed suicide. So this is the kind of stress that it is causing to people. It's a social problem. We are having a lot of unemployment. We'll have collapsing of industries all over the world. So we need to find a way in a united manner, scientifically, politically, socially, as well as economically. So this is where we should begin with. That's what I want to say.
I'm actually totally with you, Dr. Vishal. Okay, but you brought up a very important point, Dr. Vishal. The leaders are not together. But let's take a look at this. Okay, these are politicians, right? Now the thing is, this is a medical condition, right? Now, if you have a severe medical condition, Dr. Vishal, are you going to go see your politician to cure you? No one would do that in their right mind, especially some of the leaders you just mentioned, like the Prime Minister of Britain. He already has the coronavirus. So if you think about it, we have the wrong leadership who's directing this. This should not be directed by any politician. Politicians do not understand medical conditions. It's like, I'm a lawyer. I'm not a doctor. Would you go see a lawyer to solve your medical problem? No, of course not. That's insane. But the thing is, we have a medical problem, and so who we're going to see to solve it? Politicians. Okay, they're the wrong people to solve this. We need the physician, the medical community to step up, and especially the scientific medical community, the MD, PhDs who do the research, and listen to these people, because and the virologists who know what they're doing, the people who specialize in this, and not listen to some guy who's running for election, or as a leader of a country. They need to what they call defer to the experts, which, by the way, are not them. There's absolutely no way they have a handle on this. I mean, this has been proven. So that's what we need to step up as the medical community and not listen to the politicians and the world medical community, because demographically, if you have 7.8 billion, the top 1% of 1% is going to be extremely good, if you have that big demographic group. So the world leaders who work in this area, the ones that we should really listen to, and unfortunately that's not who's guiding the ship right now. It's being guided by politicians.
You're right.
I'm not sure. Well, I mean, Dr. Vishal, if you had cancer, if you had a medical condition, are you going to go see your politician? No. I mean, come on. No one in their right mind would do that. And so, and unfortunately, this is what we have leading the ship, which also gives us should have great concern, because we don't know where the ship is going. I can only guess. In other words, I'm guessing the ship, we're going to shipwreck very shortly, economically and possibly medically. The thing is, right now, what is the data on the United States right now? I mean, we're growing at the rate of 20,000 per day. Ankit, what are we doing here at the U.S.? What was our latest data? I mean, that's part of the reason Modi shut down India. They're going, wait, we can't have this over in India. This would be really insane. I mean, you guys have 3 times the population we do, and we're totally out of control, growing at the rate of 20,000. I see at the rate that I'm seeing, we're going to have 250,000 next week by the time we talk, 250,000, and growing. And it will continue to grow. I don't see it increasing at a decreasing rate at this point.
But Nick, there is a good news that at least President Trump has now started using listening to others. Because today I heard his statement. Previously he was only talking economy. The first time I saw him on TV addressing people and telling that people are more important than the economy.
Right. Well, if he's a good leader, that's what he would do. I mean, the thing is, smart leaders, you hire good people, so you listen to them, not him. So the thing is, it's good Dr. Tully's actually listening to the experts, because he's definitely not one. He's a real estate developer who spent a lot of time on TV.
He's also if you think about our mentality in the U.S., it's about the football game, basically, right? Yeah. It's the guy who's going to make that final pass at the last yard and the last second. and he makes a touchdown, and that's what this is about. Nobody's thinking about the damages that have been caused, the lives that have been lost because we waited too long.
Yeah,
I'm going to jump out.
Okay. 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 Let's take a look at the USA. 165. That was my, my prediction. How much did we grow? New cases? Only 1,700.
Reported new cases is 1,792, but I think people are underreported now.
Okay.
And that is what it is.
165, 31. Okay. Well, the thing is, obviously the number's been increasing, but I'm just wondering if it's increasing at a decreasing rate. Because, see, right now we know if it's increasing at an increasing rate, that's problematic. If it increases at a decreasing rate, then that's actually good news that says that some of the stuff is working. My belief is that in the next month it will increase at a decreasing rate, and but it will still increase because of what we're doing over here, which is mainly quarantining everybody. Where's India on the chart? Why aren't you guys up here? Where do you guys go?
We are at around 40th position. But we are also growing. I mean, so today we have more than 200 cases registered around India.
Mm-hmm.
And
wow, you guys don't even make the top 20.
No, we're not.
You should be happy. This is not a list you really want to be on.
So total 121 cases with 32 deaths so far.
Oh wow!
People recovered.
Okay,
but
I mean,
there is also concern because these are 10 days old stats, and I think Dr. Sagu have more information to share what's happening in India.
Okay. All right. Yeah, but still, that's relatively very good.
The Indian condition will come to know in next 10 to 15 days. At the moment, the data is too scarce to understand, that where India stands.
Mm-hmm. Okay, so the next 10 to 15 days, you figure you're going to have a handle on this. Now,
Yeah.
What about ventilators? How are you guys positioned for ventilators? I know we're going to run short, obviously, but how are you guys positioned on ventilators in India? Do you have enough? Let's put it that way. Does anyone know?
Yeah. Yeah. Hi, Nick.
Hey, Dr. Sagu, how you doing? Good morning. Yes.
Yeah.
Or good evening. Isn't it like 7 o'clock over there?
Nick, you missed it. They're making their own ventilators over there for $100 a pop. You missed our show.
No,
You
I
showed
know.
them manufacturing their own ventilators.
I know
India's got this.
I know they can
India
make
has it. They know what they're doing.
Nick, listen.
Yeah.
You cannot overcome the mistakes you have already made. I think
That's
every
true.
government, maybe it's Indian government, US government, everybody has a big mistake.
Right.
Instead of investing into the healthcare, they invested somewhere else, which was not needed.
Yeah.
So now,
military, would you say that would be one?
Yeah.
We won't talk about
that. Now, in any part of the world, there is no sufficient number of the ventilator available. Mm-hmm. Yes, what we can do, we can shift the ventilator from a cold place to the hot beds.
Right.
So wherever the cases are on the higher side, so Indian government, some province governments, they are shifting their ventilators to the places where they have become the hotbed for the COVID-19.
Right.
And now they are developing more. Some engineering companies, they are working on it, but we cannot make a established ventilator very soon. So what we can do, only we can shift from the cold place to the hot places.
Mm-hmm. Yeah, you mentioned about the thing is Dr. Sagu, that we can only look going forward. Here's something that's very interesting. There is a guy called Bill Gates. You may have heard of him. Okay, and Bill Gates for the last 5 years, and you can watch these on YouTube. These are 5-year-old videos, and I'm going to see if Kim can get them on IBMTV. 5 years, he said, the biggest problem our country faces, or excuse me, the world faces, is a virtual pandemic. He goes, I believe that 50% chance or better that this is going to happen. It's going to cost $3 trillion or more. Now, he was saying this 5 years ago. Now, Bill Gates, does anyone bother to listen to him? No. You know what we did over here? We disbanded our pandemic task force about a year ago. Like, no kidding.
Nick,
now people argue they quit when they were working under our current administration, but I think he fired half of them and the rest of them quit.
Yeah, exactly.
I know a lot of people who worked for the president. You know some people who work for the president.
Okay, Bill.
And they couldn't stand it. They had to quit.
Okay, Bill Gates was on every talk show, every TED, every panel, all over the world, going over and over again. And you may want to listen to him because he's worth over 100 billion, and he did predict quite correctly the issues relating to software and computers taking over the world. And he bet heavily on. Right. Okay, but here's what really happened. No one listened to Bill Gates.
Sideways.
Yeah, Dr. Seguy, you're sideways. You need to straighten your camera out. Oh, I think it's camera front.
I'm trying to listen to you, Nick.
There we go.
So there you go.
Yeah, but the thing is, can you imagine? Oh, that's Bill Gates. Let's not bother to listen to this guy. And that's what happened. Seriously. And he went through the whole analysis of this. So all this stuff, he actually accurately predicted 4 to 5 years ago what's happening today. And people just ignored him. Now, with that in mind, next time he speaks, maybe people should listen, you think? I mean, the thing is, and he said 3 trillion, and he said also something, Dr. Tully, he said, reallocate your resources toward having a task force that fights pandemics. It's going to cost money. He said 400 million, maybe $1 billion, but we just put them off. Yes.
So the beauty is that the politicians have their own axe to grind.
Yeah,
so which politician, here's to sane people? I have never heard, all across the board at the moment, the politicians, they seem to go of a different variety. Mm-hmm. So you see your country, you see Britain. The guy was telling that we are geared up to herd immunity.
Right.
And what happened with him? This just tells the story. Yeah. So this just tells the story.
Right. Yeah. Well,
this just tells the story because of the politicians and what they are listening and what they are adhering to. So
I think the world needs to adhere to policies now. I think the world has to have policies.
Of course.
We didn't listen. Nobody was listening to WHO or CDC. They would give their reports. Some were not giving all of the reports that they needed to be giving. We're hearing that they were having, confidential meetings and not sharing all of the data. But I think we need accountability at a world level for health, real accountability. You doctors were asking some very smart questions yesterday about this as well. Is why bother have the WHO if we're not following the same policies around the world? I mean, other countries shut down months before us, and we're so far behind. I would say that once you get yours flatlined and under control, don't let us in your country for another 90 days. Wait until we've cleaned up because we're that far behind. But Nick is right. The vaccine is what's going to, make all the money.
Yeah, because
that's what.
Without the vaccine, all you're doing is putting Band-Aids on a gaping wound all the time. I mean, think about it: ventilators, masks, cleaning your hands. Okay, you're just putting Band-Aids on a gaping wound.
Toilet paper.
Yeah, close this wound.
But also, I think that if a company has some vaccine, or maybe a company from America or India or maybe South Korea, so would they be using the vaccine for their country before, and then after that, then they supply to the whole world? Because that is also a problem of how they distribute and produce and massively, basically. Because every country requires those vaccines, and people would like to pay premium on that. So I don't know once the vaccine is already ready, then how we will make the distribution logistic work on that.
Yeah, because you have to manufacture.
So, Ankit, I think I think this is an extraordinary situation. I don't think that any company at this moment will think about too many profits. I am not saying that profits. I'm saying too many profits, right? So there's a caveat there, right? I think they will share. They will share their recipe with the rest of the companies which are their subsidiaries, or they will have an interaction with other companies all across the globe. And I'm sure that in this, they have to do that for the humankind. So I don't think they will have a situation where they will just, it's not a Coca-Cola secret which Coca-Cola company can guard. So they will have to, do that, because if they don't do that, there'll be a very bad backlash on those companies.
But sir, we as Indians can think about it. But I think as far as USA and other countries are concerned, I think Nick will share the details. Nick, would any country or any company agree to share their ingredients about the vaccine with the world, right?
Yeah, good question. There's two companies here, the Moderna Group and Gilead Science, that have developed. And according to Sasha, maybe Johnson and Johnson has something. 3 in clinical trials right now. The real question, of course, is let's assume one of them makes it through, or all of them make it through. Then it becomes pricing, manufacturing, distribution becomes all the issues. There is a lot of guidance that I know of in that area on an international scale. So a lot of that's going to be subject to negotiation, the patent rights that they have, what would be a reasonable markup. But I don't think we have a lot of, mechanisms in place to control this. But certainly it should have been done, but it isn't. So the real question is, what can they charge? Especially over here, in case you guys don't know, a lot of the medicine that comes out that's advanced, they charge the gazoo on it. In other words, they go, well, we found something we believe cures cancer. Here it is. It's $70,000 a year, unaffordable by anybody. Not that it's charging, but it is. But this becomes it'll become the next problem. I believe that we are going to have to solve that problem too, because there is nothing that I can see on the pricing model. In other words, what controls the pricing model once you distribute and have to get it out. Right now, we're not there yet. However, as smart as we are, we should have already been there. In other words, there should have already been in place a pricing model for international vaccines. Just doesn't exist.
Nick. Right now, we are not thinking of any type of the pricing. We should be thinking of. I don't know if you have seen the video or not, but I have seen the people from the Italy, they are throwing their currency out of their houses. So the currency is nothing for us now. We want a vaccine. The important thing is not how they are going to price the vaccine, but how we can develop the vaccine. So there are various phases of the development of the vaccine. Number 1, we would be identifying the ingredients. Number two is the production of the ingredients. And number 3, the screening of the volunteers. And number 4 is the clinical trials. Till now, only there is Chinese people, they have entered into the clinical trials. Nobody else has entered into the clinical trials. The Chinese people, they started in January production and they have started production of their ingredients. Now they have completed the ingredient and they have already inoculated those vaccine into the volunteers. Total 108 volunteers has been inoculated by the vaccine made by the Chinese people. And they chose from 18 to 60 years of the volunteers there. And now the clinical trial has already been started there on 16th of March. And now there are several phases of the clinical trials. Now what they are doing is only the domestic people. Then they will start the foreigners in China. And the third phase of the clinical trial will be the foreigners. Then they will talk to the counterpart in the other countries and they will try on the foreigners. Because before proving any vaccine, we should know the effectivity of that, safety of that, and tolerance. Whether that vaccine is safe for all the people, for all age group, for all human beings, from all people, from all the countries. Number 2, whether they volunteers or the patients, they are tolerating that vaccine. And number 3, how effective is that vaccine is.
Sure.
So all 3 parameters has to be proved with 100% effectivity. Then only they can prove the vaccine for the use for the patients. Apart from the China, only 2 people they have started doing it. Number 1 is the J&J. J&J from Washington, they have started producing something. But their principle is they will work on deactivated virus. And deactivated virus, how deactivated virus start response in the patient, we don't know. So according to them, J&J from Washington, they said they can start clinical trials from September onwards. from September onwards. They have still 4 or 5 months to start for the clinical trials. So
Right.
we are looking for them to develop the vaccine maybe till December or February in the next year. But the Chinese, they have already started their clinical trials on March 16, and they are expecting their results to publish in April, in second week of April, so that after getting the results in the domestic people, they can try on foreigners and other countries. Number third is the University of Oxford. University of Oxford is thinking of developing the vaccine, but that is for the glycoprotein. They are going to produce the glycoprotein, and that glycoprotein, how the glycoprotein would be effective, we are not thinking of that. So right now, the clinical trial has been started only by the China, and we are looking that if these results would be effective, and we can prove the safety, tolerance, and the effectivity of the vaccine. So within 5 months, we can get the vaccine in the market.
Yeah. Okay. Well, see, my question about the Chinese, let's put it this way, their clinical trials. Are their clinical trials being peer reviewed, just like any study? And the thing is, if it is peer reviewed, who are the peers that are reviewing it? Because all papers that you put out academically go through a peer review process. I have no clue about the Chinese peer review process. Similar to the paper that this was published that said, it was published on SSRN. For those who don't know about SSRN, Social Science Research Network is the largest depository of academic journals in the world. So you go to SSRN to pull up the academic journals. Well, one journal that just was published by 2 people at MIT was that warmer climates tend not to have the coronavirus, hence leading toward the theory that the warmer weather will actually pull us through this, because they say the virus breaks down in warmer weather, maybe. Now, the good thing about the SSRN study, the 2 scientists who did this at MIT said this has not been peer reviewed yet. Which is very important, which means that these 2 people put it together. They put it together based on data that they see, and there's no peer review on it. And remember, it's data that they see, and ANKIT pulls data all the time for us. If you go look at Africa, you'll notice that a lot of places in Africa don't have many, and they're in warmer climates, many coronavirus. But that could be because they're not testing people. You see what I mean?
Yes.
So all of a sudden you're pulling data in, but the data may be inaccurate that you get your studies from, which is one reason I think the people in South Korea have done a great job, even though it's kind of interesting. They pull data all the time on people. The testing of data, very important, and the tracking of people, very important. And this way they can actually figure out, okay, where is this going? How many people did this person actually see? And I believe South Korea, and you could pull it up, ANKIT, has mitigated the coronavirus. Not eliminated, but mitigated it. In the United States, we've done nothing like this. As a matter of fact, it's not even on our radar scope. I believe we do have the technology to do it. We can track people who touch people, but we have never implemented that. The reason South Korea did this is because they got hit with the MERS or SARS scare many years ago, and they actually developed their task force around this using technology to lower and mitigate the risk of the next potential pandemic. What we did was nothing. We ignored Bill Gates and we did nothing. We disbanded our pandemic specialist. We just walked away from it like it didn't exist. And that's the reason we're here today. Okay. Now
I want to share something too. We're not paying attention to probably one of the greatest tragedies in all of this, which is Italy. And one of the reports I learned from Italy is that they're utilizing people's phones to determine where they are, if they have broken the curfews or the order to stay home. So oddly enough, Italy started using the technology early on to mandate and mitigate the situation, but it didn't work because they waited too long to do anything in their country. It was just already widespread. And as we were talking earlier with the doctors who were telling us, it's not something you can see when it's contagious. Like the flu, we know in most cases the flu, if you have a fever, you're contagious. If you have a cold and you have a fever, you're contagious. But it's not like that with this disease or this virus. This spreads without symptoms. And and so we can't mitigate something like that unless we take control of people's lives. But I was interested in the fact, because we talk about technology and how to make technology work in our favor, that Italy took that step and started monitoring everyone's cell phones. Everyone.
Right.
So
I think that practice they got it from China, because China they have lost around 2 crore people, and those SIMs are not activated.
Yep.
And no one knows what happened to those people. But I mean, it's all underreported, and no one can get data from China.
wow.
Yeah, but they use testing and technology to mitigate. So there are certain things that we can do. The way I look at it, at least from our leaders, we don't even have a game plan. So the thing is, we're developing the game plan as we're going along. Okay, so
Now,
it's
we
almost
fired our game plan last year. We fired them, which I
we
find
fired-
that very coincidental. I find that very coincidental that we fire our game
Right, I
plan.
know you fire the coach, and then they're out there playing the soccer game, or you're going to play the cricket game, and just fired the coach. That's smart. Okay, but let's look at Africa right now. Africa doesn't have too many, and Africa's a hot climate. Theoretically, the viruses don't do well in hot climates. And Africa, you notice as you go to South Africa, which is colder, they have more. But you go into the mid parts of Africa, they don't have as much. Part of the theory that I understand is the virus, when you're in a humid environment, drops because the humidity drops the virus down to the ground and eliminates it, or makes it less susceptible to people. The other thing is it doesn't work too well in hot weather. Now, with that, just like Australia, and Willie Hill isn't here, okay, Australia's wildfires were eliminated by the rains that came in. The mitigation of the coronavirus could be by something that is so simple as the northern climates get warmer, and it just mitigates the virus and the potential. It gets hotter. It gets more humid. So as we go in the summertime, it may actually mitigate. The spring is going to be bad. April and May increase, at least here. India doesn't have as many cases as China. Why? You guys are further south, and it's hot there, from what I understand. Okay, hot in India.
No, but I'll tell you.
In fact,
Last week there were very few cases in Africa, and now you can see the cases are growing across Africa.
Yeah, no, I do see that, but the thing is it growing that greatly in Africa?
No, but if they don't take right action, it will grow rapidly.
Yeah, but we don't. Yeah, but Ankit, we don't have the exact data. Those could be Chinese people going in to monitor.
So Nick, that is the issue. Major issue is that how many people travel to Africa.
Right.
Because honestly speaking, no one travels to Africa.
Yeah, but
apart from South Africa.
One more point I want to make is that the epicenter in all the countries are those cities which have more population and which are the key cities for those countries. So, like New York, you can talk about Delhi, Mumbai for India. Then you talk about, not China, but maybe London. You have more cases. Then you have Paris. More cases you have in Paris. If you go to Italy, there are 70% of the cases are in Rome and nearby areas.
Right.
And
so basically,
I would add that you look at Kerala. Kerala has a hot and humid climate, but look at the number of cases which we had. So apparently, this theory of heat is something. If you look at UAE, also they have been reporting cases. Now, I don't think there is any country which is hotter than UAE at the moment.
Yeah,
right.
So the only principle is, if you have a tourism, then you have a COVID. If you don't have a tourism, no COVID. So that is why the cases were less in Africa, because in Africa there is no tourist place much. But yes, some Chinese, they are going there only for the mines and all. That is only in Congo.
Right.
Other places, Nigeria, no Chinese people, they are not going. Nobody is going there. Only we people are going as a medical professionals there. You can see in Kenya, nobody is going as a tourism. Tanzania, we are going only for the medical tourism. But there is no other type of tourism. So that is why the number in Africa, they are low, because they don't have a tourism places. And the number of the cases is directly proportional to the number of the tourist places you have in your country.
Mm-hmm. Right. Yeah, because it's people that come in. Well, that's the whole point is that we're getting data, but we're not getting accurate data. In other words, our data would be how many of these people have coronavirus that came from
Yes.
other countries that brought the coronavirus to the table, as opposed to it was there. And then how rapidly is it spreading there? See, we don't get all that great data. With good data, you can make good decisions, but we don't get that. So what we're doing.
Can I share something with you from the telecom world and working with data and working with the AI systems, including the quantum? In a heartbeat, if we went to all of the cell phone companies in a heartbeat, in an instant, we would have information of where everyone was at a minute moment, right down to the tower.
Yep.
We can actually pinpoint now within a foot. Our technology allows us to pinpoint within a foot of where a person was on a particular day. But we can do this in microseconds utilizing the AI that we have, even the quantum computers. There are a few quantum computers. And why we're not doing that to mitigate this situation, I don't understand. Like, if you know that a person contracted this in the U.S. and he's dying at Duke University, you could have pulled the records from where he's been, every step that he has taken from his phone, and pinpointed it. And I know this because I utilize that technology to do things to help law enforcement. So why aren't they doing? They could do that in a second. They could understand where the guy who walked in with a fever at our facility here, they could pull his cell phone records because nobody leaves home without it. And within seconds, they could have a pinpointed map of where he's been for 4 weeks.
Tim,
we're not utilizing that technology. We're being stupid.
They're doing that in South Korea, right?
Let's talk to him and find out who he talked to. No. Then you could take all the phones that were in that vicinity and go, who was next to him? You can pinpoint it.
So actually, now your best bet in USA is, what I understand, is a complete lockdown. I mean, honestly speaking, you don't have too many options at the moment.
We said that 4 weeks ago. Good luck.
Yeah, it looks very, dreadful to say that, but unfortunately, that is the reality which is staring at all of us.
Yeah.
I mean, that is the only way to now break the transmission, because whatever transmission has happened, you can't help it now. And even if you catch hold of these people who were traveling here and there, it is now very difficult to, they must have infected, many people across. So how many are you going to send after them? That is also a challenge. Because I presume in your part of the world, the transmission has been exponential now. It is virtually, in your face at the moment.
Yeah, that's not good, but actually, it's possible. Yes, go on.
Actually, Kim, the world has to stop COVID-19. That is the simple principle.
Yes. Okay. But then what is the next step? Okay. So they stop COVID-19. Is it possible that we do this? We test people and you get COVID-19 quote clearance so that you can actually.
Yes, that is the
ground. Okay. Because
you can.
Yeah, South Korea is actually.
Then only you can.
Right. So the thing is, once you get COVID-19, you can move around. Yeah.
Nick, you cannot catch your train while it is running. The train has to stop. Then only you can catch the train. The world has to stop.
I completely
then
agree
you can
with
trace your contact.
Yeah.
Then the world has to stop. Then only you can trace the contact. Then you do the extensive testing for all those contacts, and you can put all those contacts under quarantine.
Right.
So first the world has to stop.
Right. Okay. Yeah. You stop. Then what you do is you test. You give like when I travel, I get TSA clearance, so I can go through the security lines. Right.
Yes.
What you do is
so
you get COVID.
You give yourself a period of time, maybe around 3 to 4 weeks. Right. Suspend everything, and then start doing this testing and have a clearance of these tests. At least in a country like yours, you will be able to do. I don't think that's a major challenge in a country, in a developed country like USA. I don't think that's a challenge.
Right.
This kind of challenge is going to be in developing countries.
Yeah. Yeah, but ultimately it has to be everywhere. The thing is,
I would like to play this stat so you'll have an idea that how fast it's growing.
एप्पल नहीं बेटे
So you can see, I mean, it started from China and then it's growing rapidly in all of the countries.
Wow.
And that is what, and now you can see USA, I mean, that is what it's climbing.
we're in third place.
Nick, this is not a race we want to win.
Oh, but we're doing good, right?
This is not the horse race.
Wait! It's like the Olympics. Look, we're in third place right now.
On 23rd March, the total cases were 4 lakhs.
This is not the
Now we have around
steeplechase.
100,000. So we have almost double.
Where did you get this? This is amazing.
Hey, Ankit, one of it shows the U.S. pulling into first place. we won, right?
But I think this is not an Olympic medal which you would like to won, basically.
Right.
And we had this luxury, that
Yes, sir.
Sasha's Canada also gave us a good gift in Punjab. Dr. Aman will dwell on that. But
Yeah.
we had the Canadians coming into Punjab and they created havoc for us in Punjab.
The Canadians do.
Kentucky Derby. This is not the Kentucky Derby. We don't need to be placing bets on who's going to come in first on this race. No. Coming out of the gate, it was pretty interesting to watch that grow. I'd love to have a copy of that, Ankit.
Yep.
Ankit, I'm going to turn the mic back over to you.
Where's Ankit? Where'd he go?
We take turns.
Oh, okay.
So that because we run this show almost like a marathon now, and one of the things I'm going to recommend is that in the coming weekends, I know a lot of musicians, and I'm going to try to get them to do a marathon over the weekend.
Oh, you should be able to do it because they can't do anything else right now.
From around the world. So it'll be music from around the world, not just America, but musicians from all over the world, different cultures. And we're going to be doing a music challenge on Instagram where we kick off a song and we get people from all over the world to share how they would do the song. So we got some fun projects coming up.
That'd be great, Kim. It's like I think they did that on the Titanic. They all sang the song while the Titanic sunk. So let's go play the band, guys. Let's go play the band, guys.
The good part is Nick's sense of humor is still intact. So that means all is well.
It's not going to change.
I've been with Nick for 4 years on this Die Hard. It never leaves.
Yeah, baby. Yeah, just let's get the musicians in here, baby, while this ship is sinking because we can't do anything. I would like to get some of the scientists from Gilead Science, Johnson & Johnson, or whatever, who's developed vaccines that stop this on the show, if we can do that, so that this way I can go back doing what I do best, which I'm not really sure what that is, So, so that this way we can go back to work and go back to normalcy and expedite this, because it sounds to me we have a lot of holes in our international health system. Nick, big holes.
Nick, also, I want to add that, your team of experts are reviewing the stimulus and you're going to be giving a webinar.
Yeah, we're doing a webinar on the stimulus on April the 8th, which is next Wednesday.
Free.
So I got to hold.
It's at 1 after the show. It
Yeah.
starts after the show.
It'll be after the show. But the thing is, the stimulus and that again is just solving. It's a band-aid on a problem. It's solving potentially the economic problem. If you don't solve the medical problem, and we don't get medical experts and people that really work in the area to solve this problem, it's going to go on and on and on for months. And the thing is, last thing I want to do is say, okay, 8 months later, we're still here talking about the coronavirus. Okay,
Well,
why are you guys sitting?
I noticed some lawyers trying to get rich off of this by suing China.
Yeah,
as I always say, the only two people in our country that make money are lawyers and morticians, and the lawyer has to pay the mortician on his way out. Yeah. So the only people who are going to make money, unfortunately, are the morticians.
That's true. They do good in crises like this. But
there is always a win-win situation for China, whether it is the money from the vaccine, money from other preventive measures, the money from the medicine, money for the advocates and all. Win-win situation for China.
Yeah, that's true. The thing is, they'll want some too. Everybody get their hands in the pie. Where's Bill Gates when you need him?
Bill Gates, Warren Buffett. I haven't heard a word from Warren.
I forget them. They're investors, but Bill Gates actually does something. I know Charlie Munger. Okay, but these guys are Berkshire Hathaway people. All they do is put money in the market, take money out. Forget those people. Okay, what we want to do is get a hold of the people that are actually the scientists. And I do know some of the MD PhDs, and all they do is sit in the back room and they study this stuff. That's the people that we need.
So we're lining up some of the scientists, like an epidemiologist. I can never pronounce their titles.
And the technology.
But she's an epic, huh?
The technology. We're not utilizing the technology. They just said on the internet that North Carolina is tracking people using the cell phone to see if they're staying indoors. Guess what? You're right. We could do that, but we're not utilizing our advanced technology to combat this at this point in time. So
and if you're smart, you'll leave it in the house.
Yeah.
So the problem is you're not learning from India. You're not learning at all from India. So we had a DCAT in one of the states where they told that people who are in quarantine, every hour they have to send a selfie telling that they are at home.
Really? I didn't know that. That is so cool.
Yeah. So you're not learning from India. I'm telling you that the US is not learning from India.
No, we don't learn very quickly over here, Dr. Tulia. You got to get this, okay? If we were,
this is what we do. When you say stay at home, look at this. Everybody's going to Florida. Everybody listened to the news 2 weeks ago that warmer climates. So this is New York to Florida.
Okay.
It is so backed up that they had to shut it down. So they're all sitting still on the highway. So if you're almost out of gas, you're not going to make it.
This goes back to my prediction I made several weeks ago. The greatest amount of deaths will not occur in New York. It'll occur in Florida.
In Miami.
Watch. It'll be in South Florida. It'll be Miami, Fort Lauderdale, Palm Beach, Naples, Fort Myers, because they're a bunch of old people. And so the young people are booking it down to Florida right now, and they stop the flights, or they quarantine people on flights from New York to Florida now, which has 190. But because of their high age rate, in other words, 25% are over age 65, they're going to experience the most deaths, because we know that this affects the elderly population. So watch in the next couple months where the death rates start hitting in the United States. It's not going to be New York. The leader will be Florida. Now, that's just going to happen, because look at this. They know they can't fly, so they drive down there, and they're going to infect people. I mean, it's just the nature of the beast. So what we really need to do is actually they actually do need to use the technology and the testing to get us to where South Korea already is. In other words, we need to test people, get COVID-19 clearance on people, and otherwise you just don't let these boogers out the door, right? But we're not doing any of that. Instead, we're just saying voluntarily stay at home, voluntarily, hopefully you don't get tested, and let things go as they are, and then put Band-Aids on the wounds as they come by. Anyway, that's been our solution right now, and listen to the experts, the people that actually work in the area of pandemics. Throughout the world, there are some experts. We just got to go find them that they actually specialize, because there's some nerd out there that actually specializes in pandemics, okay, and has analyzed this to death. And that's the person, other than Bill Gates,
So,
that can actually
Sasha, what is happening in Canada at the moment? You unleashed all the Indians on us. Back to India.
Okay, I'll give you a personal example. I'm looking now at my window. There are no cars in the street. There are no people. I don't see anything. It's nothing. Oh, here's a car. Okay.
Yeah. Canadians, they are doing very good.
Yeah. Yesterday I went.
No, but you've sent the Indians back to India. I presume Dr. Aman is in Punjab, and she's, I mean, bearing the brunt of all the Canadians who have flown to India.
But out there in Canada,
No,
I
I
believe
mean,
they're pretty well. The lockdown, whatever, the
yeah.
quarantine is doing very well in Canada. Sasha,
Dr.
what's your
Tuna,
opinion?
there is one update that now the Canadian government has instructed to send a flight to India to get all their, whether they're the PR, whether the citizen of Canada, even they are from India, so they are taking back to Canada. So this
Right.
is an update.
Yeah.
Really?
So
Yeah,
how is
I
that going
think
to
in
happen,
the first,
Dr. Aman?
in
Because
the,
there is a complete lockdown happening. So how are they going to
no, in the,
now get these guys back to?
Yeah.
So they will
they are
be
sending the
flying
special,
from different cities.
But
they are sending the special flight, and even the flight from UK is also coming to India to get the people get back to their country. So these are the instructions from the government from UK and from Canada.
Right. There's something else I wanted to mention, again, from my personal experience. Yesterday, I went to a health food store to buy some food supplies. And I was impressed that everybody was wearing masks, gloves. They would allow only 5 people at the store at one time. And they would wait until somebody would leave, then the next in line would go in. The counters were cleaned after each customer. The counters were cleaned, the cash registers, and everything else. And it was quite orderly. They had a supply of everything. There was no shortage of supply. So I found it's quite civilized, well organized. And I felt that I could go to the store once again whenever I need without any concerns.
And
I have a question to doctors. I was watching yesterday a talk show from Russia, and discussing various things. And one of them was ventilators issue. And one doctor there, actually, she has some kind of a government position. She's not only a doctor, but she's also, of course, politician. She said that ventilators, all what they do, they allow sick people more comfortably to die. That it's not cure. Ventilators just make them easier to breathe, but it doesn't change outcome. The next thing after ventilator is death. So the question is, without ventilator, you will die right away, and with ventilator, you will stay a little bit longer, maybe a day or two, or whatever. Is there any validity in that?
No, Sasha, there are some guidelines for the weaning from the ventilator. So it's not like that. The elderly people whose outcome is not good, we should wean off them from the ventilator. So there are basically guidelines and some ethics also, and all the healthcare doesn't matter from India, from Canada, from US. They have to follow the guidelines, and every healthcare worker will work according to the ethics. So there is an ethics and guidelines, and according to that only we have to wean the patient from the ventilator. So whether it is the young or the old, that doesn't matter.
So what Sasha was basically asking was that if you are put on a ventilator, you are going to die anyway. That is not correct. I think that lady has just given, I mean, very off the comment kind of a comment. I presume she's not the one who is dealing with a lot of intensive care patients, so that is why maybe her, knowledge is not brushed up to the moment. To answer you very directly on that.
Now I have one question.
Ventilator helps you tide over the acute distress that the lung goes through. And a lot of patients, no, I won't say, I don't know exactly, I was looking for the percentage of critically ill patients who have been put off ventilator. I could not find the exact data on that. But yes, it just tides over that very critical period when your lungs do not support your body. But meanwhile, with the medication, once your lungs are supported with the medication, a lot of people are off the ventilator and they do survive. That I would not agree with statement that was given
Yeah,
by the doctor.
basically the ventilator is to assist the respiration, and when we are assisting the respiration, and then we can have a time to cure your other problems. So then we can give the medications. We can give the medication for the heart also, for every for all type of the organs in the body. So ventilator, I mean, this is not a medicine for anything, but to assist the respiration while we are treating the patient.
And that's
Basically,
something to
they
consider that
cushion the oxygen to help the lungs expand and contract, and you cushion the oxygen at the same time.
It is like the same condition in earlier when there is nothing in the public place. If somebody is sinking, that we blow with our mouth to mouth respiration. So basically, we are giving the air or the respiration. We are assisting the respiration by putting a positive pressure in the airway. So we are just blowing. That is known as a mouth to mouth respiration. So that we can also take the patient out from the acute condition by doing this. And the ventilator is doing the same thing. Ventilator is assisting the respiration by giving the positive pressure from outside.
Meanwhile, the drugs work. Meanwhile, the drugs work, and the patient can be drawn off of it.
Yeah.
Dr. Sago, I want to tell you something very interesting. I was watching a couple of days ago television, I think it was CNN, and they have an expert by the name Dr. Gupta. And Dr. Gupta was showing the right technique, how to wash hands. And it was exactly 100% what you showed. Exactly.
Yeah. So basically, that is the standard steps for the hand washing for the health professionals and for the civilians also, for the other people also.
Okay.
So basically, we need to clean the interdistal clefts. So the most of the germs are present there. So if we can, because we only clean this part of the ventral surface of the hand. We should clean the dorsal part also. Yeah.
Oh my God.
All.
There's a lot of dancing. So if you look at it, there's a lot of dancing of the hands going around.
We know the game. Dr. Tula, I want to tell you, I have a fan that I recently got from Afghanistan, and he says he knows you.
Ma'am, I have a lot of patients coming from Afghanistan.
You have friends all over the world, but I had a fan that recently came on, and he's been chatting. He goes, "Oh my gosh!" He goes, "How do you know Dr. Tula?" And because he said I saw him on your show, and he goes, "He's a friend of mine," and I'm like, "Wow, you're in Afghanistan." So it's what a small world, right?
Yes, it is a small world. There is no doubt about that. It's so good to. You've all become a part of our family. It's so good to see you every day, and it gives you, and especially Sasha. He's the youngest in us.
Here, I would like to comment about the personality of Dr. Tula. So he is he's an expert in making friends all over the world, especially the females.
Now he started pulling my leg, I guess.
That's what family's for, right? You keep each other grounded. I love it.
Easily he makes the family.
So, Sasha, I was just quizzical about you. There is a little bit of a photograph behind your head. It looks like a beautiful painting on some lady. What exactly? Would you like to show us that painting?
It proves my statement.
Behind me?
Yes.
Yes, absolutely. There's a beautiful painting of a lady behind you.
Okay.
Dr. Dula, I think you should visit Sasha's place and maybe after
Yes, I
COVID.
would surely. I would show. Yeah, yeah. Please go ahead, sir. Yeah, there's a
Wow.
yes. This lady. Can you zoom in to the photograph? I would love to see the painting.
She's
It looks
beautiful.
very good from behind.
This is my daughter on the day of
Okay.
meeting.
Oh,
Wow.
very
Okay.
good, very good.
So I
Very
can't
good.
see it. Can you zoom it a little?
Yeah,
Can you zoom in?
try. Hold on.
So I think Dr. Saggu was completely right. I think
No, because
about
I was
it.
seeing it the other day also. So I was about to question him. It just skipped my mind always. Okay.
Okay, I will think how to properly do it.
Don't take it off the wall. You know how we
Yeah,
women
Sasha,
are
it's
about
okay.
taking
I mean,
things off the wall. She's very lovely, Sasha. She is very.
In the meantime, do anyone know about patient 31? Patient 31.
Korea. Yeah, South Korea.
yeah, Korea, South Korea.
You know what I noticed? Sasha hasn't gotten in his car and driven down to Florida. He's staying in Canada. That highway is a highway that goes all the way from Canada down to Florida. That highway that you saw, it's one big highway, and it drives all the way down to Florida. I've been on that highway myself from the bottom part of Florida, and I drove all the way to Canada to help family out. A long time ago, I was, delivering family from one place to another during a emergency situation, and they could not afford to fly. So, but it was an interesting trip. I'm glad I did it once in my lifetime. I don't ever want to do it again. So when I see people on that highway, that long, endless highway, I feel sorry for them, and especially if they're stopped at a checkpoint and there's no traffic moving for hours. I mean, I can't imagine what that's like to sit on that highway with nowhere to go. So anyway, Sasha, did you find your? Oh, we lost Sasha.
Yeah, we lost Sasha.
Yeah, I saw Dr. Dula.
He was trying to.
Dr. Dula made Sasha disappear.
The patient number
No.
31 of Korea. The Delhi patient. The Delhi patient is going to take that record. What are your views?
What?
The patients, we have one incident in Delhi where in a religious place, in a prayer place, there was a group of people who were together and they were together up till last evening, I believe. And so they are around 440 patients have tested positive in Delhi itself from that group.
Patient 31.
No,
This story comes out of
it's
South Korea.
Okay.
Patient 31.
Okay.
35-year-old Chinese woman flew into South Korea. All right. She flew into South Korea feeling absolutely fine.
Okay.
On February 6th, she was in a minor car accident in South Korea.
Okay.
She took herself to the hospital and she was fine. No major accidents or bones broken or anything like that. However, she had a slight temperature, and they wanted to test her. She said, no, I'm fine. I'm not sick. I'm fine. I want to go. She left. Okay. She then attends church. She goes to church on February 9th and she goes to church on February 16th. Okay. Right after that, her symptoms started to come. All right. That's a long gap between her feeling fine.
Yeah.
And then the symptoms coming.
Yeah.
Doctors advise her to check immediately for the coronavirus, gets tested, and she's got it. Just prior to the testing, she went to a hotel and had a buffet lunch.
Oh my goodness.
Okay? So she's gone to 2 churches.
Yeah.
And she's now had a buffet lunch at a hotel, which so many people can do.
Yeah.
Which is just a regular day. 2 days, all the symptoms, and they officially make her patient 31 in South Korea.
Right.
Her alone, that one person, patient 31, created approximately 60% of all cases in South Korea.
60%.
60% stem from patient 31.
Who was a 35-year-old woman who said she felt fine
Who was, went on with her day.
and went to all the places.
1,200 people were infected who were at the church. Those two masses. Wow. 1,200 got infected, right?
From her.
From her. And then some of them went to her funeral. So infected the people at the funeral, and it was a domino effect.
Well, of course, they all have families, friends.
So out of the total 8,897 infected in South Korea, this patient 31, unfortunately, created 5,382 of those.
That just blew my mind.
That is patient 31, and that is the story that we need to understand. So if you're meeting up with your friends at home, 4 or 5 of your friends are coming at home, if you were going to the parks, if you were at a beach in JBR today, and you may think, but I was doing social distancing. How did you get there? You walked, you may have touched a rail, you may have coughed, you may have done something. It takes one person.
Wow.
One person who feels absolutely fine to have it in their system and infect.
So that is what the story about Patient 31, and that's
Yeah.
what we are very concerned about USA especially, that they are not ready to listen or maybe checking what's going on in different countries and still not taking any learning.
Something I didn't hear from them is it sounds like to me they're only checking back to when she had symptoms as opposed to prior to her symptoms, which I have learned, thanks to our world conversation, that you are infected prior to your symptoms, that you're infectious upon being infected and contagious at that moment. I noticed that here in North Carolina, when somebody was found to have infected 500 people, they didn't look at the 2 weeks prior to his fever. They only looked at the day of fever on. I think that we need to get smarter than this, and we need to take a look going backwards a little bit longer, because we are infectious at the point of being infected, and nobody's bringing that up. What are your thoughts about this?
You are infected before starting your symptoms.
Right, exactly, Dr. Sagu. You've been telling us this from the beginning. And you and Dr. Patel and Dr. Amadi, welcome. You guys have been sharing this with us from the beginning, that we're infectious, we're contagious from the point of infection. And we're measuring that.
This is what we technically call asymptomatic carriers. You are a carrier of the infection and you don't have symptoms yet. So
even you don't know whether you have disease or not, but you are spreading the disease.
Exactly.
Exactly. So that is why the quarantine, isolation, disinfection, everything is good. You have to stop the COVID.
Discipline, right? We keep talking about the disciplines of our cleanliness. I know people are getting tired of washing their hands. And I think by the point that you've been self-contained for a week, you still need to wipe your surfaces and keep clean, because you still could be contagious until you've probably stayed home for 3 weeks, 4 weeks. Hi, Sasha.
So,
hi. I've just
the period is, I'm talking the incubation period that we say, the moment the virus gets into your body, and then when the symptoms are shown, which we call the incubation period, between getting infected to getting the disease, right? So that incubation period is ideally 2 to 7 days in most of the cases, up to 12 days. To be on the safer side, we have said around 14 days, 2 to 14 days. So if for 14 days you are fine, that means you can be safe if you never got those symptoms. So till 14 days, if you don't have the symptoms, then you can be at ease that yes, I have not got symptoms from anywhere. I have not got disease from anywhere. It is not 21 days. For an individual.
Dr. Amar, basically, that is the mean incubation period. Mean incubation period is only up to 5 days, 5 to 6 days, and the total incubation period is 2 to 3 weeks. So the dangerous is the mean incubation period when your symptoms has not yet come and you can be carrier. So that is asymptomatic carrier. So one update regarding that, I would like to comment upon the one update the Indian people had made. One person from the IIT and one person from the AIMS, they developed a machine that is the air lens minus corona machine, and that machine is to spray the disinfectant because we are the overcrowded streets, and by the use of the sanitizer we cannot disinfect the streets. So they developed a machine that is like a robo, and that basically spreads the water droplet, and the water is iodinized water. And what this iodinized water does, it causes the oxidization of the protein of the COVID-19. So because this COVID-19 has a spikes on that there is a glycoprotein, and that glycoprotein binds with the receptor in the epithelial cells of the pneumocytes type 2. So basically, it deactivates the virus by oxidizing that protein, and this is very effective. I think within few days that machine will come in the market, and by the use of that machine, we can disinfect the streets with the crowds. We can disinfect the mass gatherings. So, because by the use of the alcohol-based sanitizers, it is not possible to disinfect all of the streets. The alcohol works on denaturing the protein. So this is the good news if it works well.
And I still don't want to get into a crowd anymore. I don't want to even think about self-disinfecting, or I just want to stay home in my own little place now.
You just over to India, you will see on the highways a lot of crowds are going on. So, the people of 1800 has been evacuated from a mosque or a center in Delhi today only. And out of that, 424 were suspects. And out of that, around 24 to 30 patients, they have been this COVID positive. So the crowds are everywhere that you have to come out of the US.
Yeah. But they're not being careful. They're not taking care.
One more thing is that the steam disinfects. Steam kills the virus. So we have
that is for the throat, for the patient.
Handheld steam sterilizers, rather than cleaning the doorknobs of the commercial places, the dresses in the trial rooms. Like we have one friend who happens to be in the garment industry. She was just thinking of how in the coming days when the lockdown is over, how are they going to disinfect those clothes which they're going to give to the trial rooms. So they have come up with this idea of using that steam set on every garment that goes inside the trial room. Even for the doorknobs, I think a steam sterilizer, a handheld steam sterilizer is a good option.
You can use your steam iron for that. With the steam iron, you can disinfect your doors, handles, you can disinfect your elevator buttons, you can disinfect all of the doors, everything you can. Instead of doing iron, because you're not going outside, so you don't need to iron your clothes now, then you can use that iron for disinfection of your doors.
That's pretty smart. I have a steaming machine that I steam my clothes with because I don't like to iron.
Yes, that you can use.
You can use
wallpaper. It's so hot.
So Kimberly, you understood now why So did you understand why I told you that Indians are good at, inventing?
That's a cool
They
one.
are the best inventors in the world.
I can use that. I can steam my my house, but I do know it melts wallpaper. So I'll just bless my house with the steamer. That's a good idea. Very, very good idea.
So now, Kim, I will take your leave now. Thank you so much for having me here.
Thank you so much for sharing all this helpful information.
Kim, Aman, Ankit, Dr. Tula, Sasha.
Dr. Sagir.
Pleasure.
Many blessings. Many blessings.
Online handshake. Online handshake.
As many blessings. We got our own sign language now. We have our own sign language. I love it. This is the in crowd. This is the in crowd.
Thank you so
What
much.
happened to your in kit?
Dr. Tula,
Yeah, sir.
I'm just supporting you. You said that there is huge innovation in India. There is one more innovative information. Dr. Geeta Rai has invented a PCR based testing kit that takes
Wow.
4 to 5 hours actually, and they
A
are not
PTA
targeting only the COVID-19, but they can test the new virus as well. Are you well aware about this?
Uh, I also saw it on, television only, that there was this kit going around. But now the only thing is we need to understand that, please. There are two, three things to it. One is the validation of the kit,
Absolutely.
because ultimately, honestly speaking, we have to validate it and see that how much sensitive and specific is it. The problem is with the specificity, not with the sensitivity. So that means it has to be 99% accurate. Number two, it has to go through a clinical trial before we start. Straight away jumping on the case.
Absolutely.
So
Absolutely.
I think
You're right.
it's a positive thing. Let's take it in the positive stride. That if someone has done that, I would really congratulate that person and say let's see how it goes.
But we believe that Banaras Hindu University is one of the renowned university and the oldest university in the world, and they are working on the right direction. They have approached to the Drug Control General of India also for their fast track approval, so that they can take care the coronavirus infected patients. One more thing I want to know, Dr. Tula, plasma from knee covered patients from COVID-19 can treat others infected by COVID-19. This method of treatment is being researched in several countries. They are looking at harvesting virus, getting fighting antibodies from the blood. Can you lend me
Yes,
some
sir.
information
So
on
yeah,
that?
so there are some kind of see, as I told you, this is a very liquid situation. That means it is a very fluid situation. People are trying all kinds of permutation combinations some kind of a I mean, uh, remedy for this virus. So apparently, in certain countries where they have the bandwidth to do that, they are trying to isolate the antibodies which the normal body produces against this virus. And there are some trials going on, but these are very early days. Honestly speaking, it will take a little time before any of this gets standardized as a therapy.
Great. Thank you very much, sir. Thank you very much.
Yeah, I think
Uh,
we need
I
to be
just want to
very
share.
careful. And I think that there's going to be a lot, as I mentioned the other day, that business people, they take this as a means to scale MVP. So but I like to hear. I love knowing that there's test kits coming out, especially at the PRC level, because that's the one that's been taking 10 days. What company is that? Do you have the name of the company?
No, not at the company yet.
In India, the company name is
Dr. Rai.
MyLab.
Pardon?
In India,
Dr.
the
Rai.
company who is doing the test kit, their name
Yeah,
is MyLab.
Indian company is
Okay.
my lab.
Okay.
Yeah.
Mhm.
And there are also a lot of testing going in different pathology lab as well. And the government has did the capping of around $80 basically, 70 to $80. And with that, you can go and get yourself checked. But that, Dr. Tullah must be have more knowledge that it will take time to get
So,
those
so
tests.
yeah. So what they have done is, at the moment, what they have done is that one, they are not doing random testing. That means that the companies which are doing testing, they have a procedure which is to be followed. One is that you need to upload your identity before getting the test done. That means you should have an Aadhaar card or some identity card which is there. Number two, the doctor's prescription has to be there.
I agree.
So they will first they will validate that, and then only they will send their person in proper PPE gear to that place and get this test done. So it's a little bit with an ifs and buts. Tinkers are attached to that. So it's not that readily a kind of scenario, but at least the government is now they're virtually now opening on to this. I presume the more the test kits come into the system, the more they will open up. Because unfortunately, they're not also having too many choices on this.
But Dr. Dula, I would also like to understand that how many times one should get the testing done, because I mean, people have symptoms and their symptoms get overlooked maybe for a couple of weeks, but after some time, I mean, they think that they have those symptoms, and then they visit the doctor or maybe they call someone to get the testing done. For I
Ankit, we
mean,
need to understand. Yeah, so we need to understand what are we trying to achieve out of the testing. Countries like South Korea, where they started doing, they upscaled the testing because they wanted to be sure that people who are not having COVID, they are separated from the people who are having COVID. In India, unfortunately, the challenges with the test, because the kits are not going to be ever, at least for coming 1 year, to reach that volumes where they can test everyone. So again, there is so we don't have much of a choice except what is happening at the moment, that is a lockdown. Because we don't have, honestly speaking, we don't have the resources to do this kind of massive testing. It looks very good on paper when we compare ourselves with countries like South Korea or a Hong Kong or a Taiwan, or these countries are limited countries with limited amount of population.
yeah.
And I mean, separate the people from there. A country like India, which is so widespread, it's going to take. It's a mammoth effort to do that. And honestly speaking, it's very difficult.
I totally agree, sir. That's why I
And plus,
told earlier.
you've seen what has happened today in the Delhi episode. Now the
Yeah,
question is,
yeah,
it's not the religious congregation was there. That's not a problem.
yeah,
It was on 18th. That is not a problem at all. The problem
yeah,
started when they started concealing. So
yeah,
I heard Dr. Saggu say that it's a religious. Now the question again is that, see, people were from outside also who had come for that, right? And they
yeah,
tried to conceal those people by sending them off to different locations in India.
yeah.
That, I guess, was not the right thing to do. I agree that you can have see, the lockdown was ordered on 22nd, if I'm not wrong, Ankit.
Yeah.
22nd.
So
No, no,
so
24.
legally
23rd.
23rd. So legally they were allowed to do a congregation before that date.
Yeah,
So they did it on the 18th. The only
yeah,
thing which they should have taken care was that once the congregation was over and they had these people, when they knew that these people had come from outside, one, they should have quarantined them for 14 days. Even if they did not do that, they should have
yeah.
at least reported it to the authorities and told that these
So
people
that's
have
what
come from outside. I
I
don't
agree, sir.
think there is any problem in that religious event. I presume the media is blowing it out of proportion on that part. That's something which, I mean, I will not even get into that. But I presume that if that was happening, the only reasonable thing was to declare that this has happened, and these are people who are from outside, who have come from these countries which were COVID positive. Because apparently, I believe it's not only the religious congregations' fault on this. Honestly speaking, these people were screened at the airports and they went through the airports. So
Yeah,
there is there is a fault line there also. So
completely agree,
I'm
sir.
not defending the people who did this religious congregation, but on the other
Yeah,
hand, both the parties are at fault on this,
and I think that
and
there are
I'm
two
sure
points which.
Mohammed will agree with me on that, sir.
Yeah, see, rules are rules. Rules are made for the comfort of people, not for discomfort. See, we have to save the nation. We cannot ignore any single person. If somebody is doing whatever is religions hardly matters out here. Humanity is the first religion. We have to save the humanity. We have to save the nation. We cannot compromise. We have to take a stand against everybody who is doing wrong thing.
No,
So
you're
basically,
right.
had these guys declared themselves, I don't think this kind of problem
See,
would have really
today,
happened.
I just listened to the administrator, the person who is taking care of the Markaz. He said that he informed to the police that we are 1500 people out here, and please help me out to disburse according to the location. So police responded back, go and talk to the higher authority right now. They approached to the higher authority. Then higher authority responded back, please submit your list of the people, how many you are, from where are you. So they submitted the list as well. But due to some reason, we cannot argue on this, who is right or who is wrong. but there is a mess actually. There's a mess. We cannot say the police is responsible. Actually, the mass is responsible. If police is not responding to them, they can approach to the media as well. See,
Yes,
in
I think,
today's today's
I
scenario,
think in
media
today's
is
scenario,
very helpful. Media is playing like an angel actually. They are working day and night selflessly, so they can approach to the media as well. We cannot blame to the police only. See, I am a
and
five person
I
in
think
my family.
it's time to take
I'm a five
accountability
person in
within
my
ourselves.
family. Ankit, I'm a 5% in my family, and we never ever tried to go out.
Yeah,
We are following the discipline
yeah,
just to protect the nation.
true. And I think that we have to be accountable from ourselves. I mean, you can't
Absolutely,
blame government and you can't blame communities and you can't blame people because people have to take those accountability. Government can't stop the coronavirus. We have to stop it. And there is no
absolutely,
medicine. Just that you have to stay at home. That is what the medicine is. And if
absolutely,
no one is ready to listen and no one is serious about it, no one can help it out because it's not about your life. It's about the nation's life and
absolutely,
the humanity in the world or in the earth right now. So
It's
that is
not
absolutely,
the
what. And
world.
first point, sir, you mentioned that South Korea, Taiwan, Hong Kong. So these countries have limited resources, and I think as our ancestors also say that जितनी चादर उतना पैर फैलाना चाहिए. That means they have limited resources, and on the basis of that, they have done
absolutely,
the good work. But
absolutely,
when countries have more resources and they have more money, they think that they can just get it away. So that is what the lesson is that we have to do things at a state level, and the central government would take the participation and talk to everyone and do the needful. That same thing happens in USA, but unfortunately, the governors and the presidents are not on the same track, and that's why things are not falling down. And they are thinking about the dollars and not the life, what is more precious.
I,
जी, जी,
Ankit, and I wanted to zoom in on you a little bit before that, but I think you're right. Yeah, it's about the dollar. The filthiest, most nastiest germ spreader in the world, the dollar. But exactly, right? And I don't know, is yours made out of, ours is made out of cloth. People think it's paper, but it's a cloth. But let's think about this. We have a personal obligation right now to our society, our communities, and to the world. We just learned what Patient 31 did, and
Yeah.
they are blaming Patient 31 for 60% of the contagions in South Korea. But Patient 31 traveled outside of their country. So I wonder how many people did Patient 31 contaminate outside of the country. So we got to ask that question. Yeah, but the thing is that we should have been better informed. If somebody had told me in January that this had spikes that would tear holes in my lungs and permanently damage me, I would not have been at the Super Bowl. I would not have gone to the events prior to the Super Bowl, to all these business events. I would have stayed home. But nobody told me that. Instead, we were getting the message, oh, it's not that big of a deal. Don't worry about it. But it was, and nobody was telling us that it spreads before a fever. Every information that people received in the US was call the doctor when you have a fever. We weren't told that we were contagious before a fever. So I look at New York. New York is going to explode with this problem. They think they can run away from it by going to Florida, but you can't run away from it. Once you've been contaminated, that's it. So you just need to stay put and ride this horse out. You just have to just let the virus take its course. If you get sick with it, call for help, call for a ventilator. I think I heard a doctor say the other day, we need to start treating people at home. We need to take the treatments to the house. So, deliver the proper tools. Ventilators can't be used just by anybody, but we need to be treating to the house, not bringing people in, because we're contaminating our heroes. We're contaminating our physicians, and that's not good. We need to be more conscious. Sasha?
Do you know why so many physicians and medical professionals, they're dying helping other people? Simply because they're getting extraordinary dose of this contaminated coronavirus. It's just, I'm very skeptical on this theory. If most of the population will get this coronavirus and survive, they will develop some antibody, which will, from that point on, they will be insulated from further attack by coronavirus. And not only that, they can help other people. Two things. Number one, it depends on what kind of a dosage of contamination they will get. If it's a fairly large dose, oh my God, it's people would die. And second of all, if your lungs are permanently damaged, then what's good about immunity that you are getting as a result of it? It's just not good enough.
Well, that's what we have to look at, Sasha, is the permanent damage to the human body. Nobody told me that there was going to be permanent damage.
Oh.
And I think we lost Dr. Vitale. I didn't get to say goodbye to him. But nobody, there, Dr. Tula. I'm sorry, Dr. Tula, not Dr. Vitale. And Nick is on, folks.
I'm back in. I can cause trouble. Okay, not so fast. Not so fast, Kim. Wait a minute. Hear me out. See, Dr. Tula is a plastic surgeon. Okay, there's no problem with him continuing doing plastic surgery as long as he's COVID certified and his patient is COVID certified. Okay, then the patient can come and he can do his plastic surgery. So why don't we have a certification that you're
certification? There you go.
You're COVID certified. I have to see.
Another way to make money.
Okay, I mean, it's all about the money. Come on, we're in America. Some of us are, and we know it's all about the dollar bill. All right, so why not have a certification program? Okay.
Is it a COVID USA certification or COVID global certification?
Well, the thing is, Dr. Tula could be COVID certified. Why? He's been in quarantine for 14 days and he's fine, so he can go back to work. Okay. Then his patient, COVID certified, they've been quarantined 14 days, no symptom. They can come in and be a patient. And then we get some people back to work rather than, we can't do anything. We all got to sit in our houses for 9 months. You know, even though they say it's only 2 months, watch, it's going to be 9 months, and there's nothing we can do. Baloney. There's stuff that we can do. We're just not thinking outside the box. You got to put the little thinking cap on, right? You know? I'm going to get Mohammed's hat in just a moment. I have his hat. I've got a copy of his hat. So not so fast on this we can't get back to work stuff. We get back to work so we can build up the economy again. Not everybody has to go home. You can be COVID certified. And if you're COVID certified, you're back to work.
Who will certify certifiers?
Yeah, you can have medical doctors. They're smart guys, right? They can be certified and they can certify people. Hey, look, Sasha's been sitting in his room for 14 days. He doesn't exhibit any symptoms. Give him a certification and send him out the door.
Yes.
Okay. There we go. And that's what we should be doing. But we're not even thinking that way. We're thinking everybody stays home. And then what happens? Then we release everybody without testing. Oh, that's bright. You know, that's smart. You know, so the thing is, that's not a solution. We need a solution.
Nick, can we also have a quarantine course for 14 days? Before you go for quarantine, you have to do a course. And then you learn how to quarantine, and then you do that quarantine.
Yeah, of course. And you have plenty of time to learn, Ankit, because you're sitting around your home doing nothing. Half of them are watching IBMTV, mainly because they have nothing better to do. Think about it. And this is only day 2 here in North Carolina. We get to go this for 30 to 45 to 60 days.
90. We all took a vote when you weren't around. We voted 90 days.
90 days? Okay. So the thing is, I got to deal with this for 90 days? Okay, how's this going to happen? How's this going to work? It isn't going to work. I have to see let's see, what is it? Somebody has to turn on my water heater in the townhouse I have up in Raleigh. So I got to meet with them. And so what happened before the meeting, the lady gives me a call. Do you have any symptoms? Oh, I got to do your COVID certification. Well, what COVID certification? Well, we're at the state of North Carolina. We got to ask you some questions. What are the questions? Do you have any exhibit problems with COVID-19? I said, no. Do you have exhibit other problems? I said, yes, but you don't want to hear about them. Okay, so the thing is, are you relatively healthy? Yes. Okay, good. Then you can go meet the other person. And so I got certified to meet somebody tomorrow. Boing. So I might not be here later tomorrow because I go up to Raleigh to have somebody who turns on my water heater, and we're actually going to be in the same room together for a very short period of time. But we've been COVID certified, sort of.
Nick,
Now I haven't taken a test.
by your drugstore.
Yeah, I got all that stuff. I got it. I don't have to take a test, but that's because we're loosey goosey about this stuff around here.
Good glasses that hug the eyes and face. Okay.
Yeah, I got all that, and I maintain my social distance. Don't get me wrong; I'm pretty antisocial. I'll maintain the social.
There you go. Oh,
beautiful. Beautiful.
Okay.
Yeah, Sasha, thank you for doing that.
Okay.
Beautiful.
That's
beautiful.
Thank you for doing that.
That's pretty good.
Sasha's daughter in the back. She's very beautiful.
Yeah. But the thing is, we're not even thinking of those solutions. We could track people. They're doing that in North Carolina right now, so we're tracking people. Okay, but
this was the safest way a few weeks ago. It was better than what we were doing. Oh, check it out. Ankit, how did you do that? That's way cool.
That's really cool. I sent him it by messenger. This is a picture of my daughter in a day of her wedding, 24.
So how young is she?
At that time, she was only 24, but now she's a little bit older. No, she was 23.
Okay.
Nick.
So, Dr. Dullah, we were discussing about a 14-day quarantine course before we go for quarantine ourselves.
Can we talk about that?
Yeah. So, sure.
Yeah, I wanted to mention, she's a publisher of the magazine Geriatrics and Aging. So I don't know if they have any articles about the coronavirus effect on older people. I have to check with her. Maybe she has some information.
I have one good news. 95 years old, Clara Carcini she's from Italy. She's 95 years old grandmother. She survived from the coronavirus. She's the oldest person in the world.
Wow.
Hats off to the willpower and the immune system and the doctors who treated her.
For recovery, did they have the data on that? That's a beautiful story.
Mm-hmm.
Beautiful story. Oh, check out Nick. We got brothers.
Hey, my brother Muhammad, baby. Hey. I told you I have a hat like that. I love these.
You're missing it.
I actually wear them all the time. I love this hat, So the thing is, we wear them all the time.
Nick, are you from Texas? You look like a cowboy man.
This is Indiana Jones hat. Indiana Jones.
I wear it all the time, buddy. I mean,
he does.
It was out here. But the thing is,
he wears it all the time.
I was in Mohammed. I was going, the dude has my hat. I don't know how you got that.
I can say the IBM hat.
It's IBM hat. Yeah, you got it. Mm-hmm. So yeah, I do have my hat and I do wear it because, they used to wear it all the time in the 40s. And the reason why it keeps your head warm in cold weather. Then all of a sudden we got rid of it and for no reason whatsoever. But the thing is, it actually had a utility. I mean, there's some things out there that actually have some use. Hats have use, but they get rid of it. But this whole pandemic deal, we need to get serious about it and get some work done. In order to get work done, we need to get people COVID certified and get them out there. This is why I can go to a restaurant. I mean, I love to go out to eat. I mean, I moved up to Raleigh, so I go out to all these restaurants they have there, I mean, I can't even go to my Indian restaurant. Actually, I do takeout once a week. Okay, so I can get my curry. They have great coconut curry, by the way, in case you didn't know, because we have real Indians here that actually know how to make the food. And so the thing is, but we can't sit down and eat there because, Oh, you can all catch the coronavirus. Well, let's get certified, buddy, because there's only 2 incidents of coronavirus in our whole county. You know, get everybody tested, get them all certified, and get them back out on the streets. Yeah, but right now, I don't think there's any plan. The plan is, well, we're gonna see what happens next. Okay,
Yeah, so
well,
that's the punchline. That's the punchline of your president. Also, we'll see what happens.
Well, of course, that's all he says. Come on, Dr. Bill. The reason he says it because he doesn't know what's going to happen next. So he goes, well, we'll see. And the reason why we'll see is because I have no idea how to look
what to do.
I have no idea how to look in the future. I can't look at statistics and see how they grow.
I love the way you make a pun on your president. I mean, any other country, it would have been absolutely mayhem.
Oh, take me away! Take me away! You know, no. The thing is, did I ever mention him by name?
No, you never.
Grand I'm a lawyer. I know how to do this right. Okay, you never mention your leaders by name. You just keep that quiet. You just say, "Well, our leaders," and then you inferred it was this guy who heads up this place. I mean, it could have been somebody else. It could have been the Supreme Court justice, for all that you know, right? So anyway, the thing is. What we do is
we'll have to learn a lot from you. I guess on this.
Well, the thing is, it doesn't take a rocket science. Now,
if you want to know a lot about our president, this guy, David K. Johnson,
he wrote a whole book.
Follows the president. That's all he does is he follows the president. He's been doing this since the president was a kid.
Kim, don't tell these
about him. That's all he does.
Don't tell these people what really goes on here. See, they believe everything that happens in Hollywood. You know, right? Ankit goes, everything's big cities, and we have martial law where little Texans running around. Okay, so they believe all this big myth, and that we kind of know what we're doing here. No, it's all. There we go.
That's right. Ankit's got it. Ankit's got it. Yeah.
Ankit's got it, baby. Ankit's been over here.
Nick is laundering money now. He will wash it and sanitize it for you.
There you go.
Nick will wash it.
I'm reaching. I'm trying to grab it. You know, it's kind of the name of the game.
That's right.
You know, so the thing is, but you know, the plan. Now Sasha's a chess player, right? You ever sit down at a chessboard and say, "I have no plan. I don't know what I'm doing. We're going to see what's going to happen next." What happens if you do that, Sasha? If you're going to say, "I'm going to see what's going to happen next. I'm going to play chess, but I'll just see what happens next. I'm not going to think ahead. And what's going to happen next? You're going to have your rear handed to you every time, right, Sasha?"
Yeah.
Yeah.
By the way, last Saturday in Toronto was the first ever chess tournament where the first prize was a toilet paper.
A toilet paper. Yeah, there's like all these
kinds. I know a guy who won the toilet paper.
There you go. Oh my God. Well, that at least is worth winning, I guess. You know. But chess.
That's why you need your strategy and your tactics to win the toilet paper.
Tactics. But the thing is, you have to think ahead. You have to strategize. You have to have a plan. But you cannot sit down on any chessboard and say, "Oh, I'll see what happens next." Because if you do that, the other player will destroy you if he's any good at all. And that's the nature of the beast.
Actually, the other player will show you what will happen.
Next. Instead, what we have here in our, quote, leadership that has gut instinct about everything, and I'm not going to ever mention the name, okay, because that would give away the party here. We're not going to mention his name. We're going to see what happens next. Well, I can tell them what's going to happen next. More people are going to get infected, and more people are going to die. This isn't rocket science. It's, hello, McFly. Is there anybody here? Hello, no, we're out to lunch at this whole thing. And the sad part is, if the world follows us, which you guys were smart over there, you didn't. You went ahead and quarantined everybody. If you followed us, you'd say, "Let's wait and see what happens next." I can tell you what happens next. Everybody's going to get infected. Everybody's going to die. It's not rocket science. So the thing is, you have to be proactive. Have to look for solutions. The vaccine is one solution, but getting people certified is another solution. It's never been brought before anything that I've heard from our great and glorious leaders. Okay. And you do that by testing. What's that? You just test people. I mean, that before they come out. test them. Okay, the disinfectant system. Oh yeah, clean everything. Yeah, that'll get rid of everything. Come on.
You get reinfected right after you walk out of it, right? You bump into somebody.
So that's a machine installed in China in some cities, and that's what they're doing.
Oh, they make the person walk through the disinfectant. Oh boy, that'll solve everything. Okay, I mean, it doesn't hurt. I mean, doing things like that doesn't hurt, but testing is one of the keys, because then you can decertify somebody. If somebody you find out actually does have that, but walking through a bunch of mist, come on.
Next question: have you thought about that certified people will get from the government check instead of $1,200, $1,500?
Hey, that's even a good idea.
Enough of people to be certified.
Yeah. Sasha, you come up with a good idea right here on IBMTV. Okay, here's what we're going to do. Everybody gets $1,200 or $2,400. Here's what we should do. Everybody gets tested gets $1,200. I don't want to get a test. Good, you get nothing. Guess what?
I think anybody who stayed home the longest gets the most money, like me.
Yeah. Well, I mean,
I think you should get paid for every day you stayed home.
You get tested. Okay, you get your money once you get tested. But
no, I think you get your money for staying home.
No,
that way you don't go to work, you stay home, you get paid. I think the people who stayed home get paid. I've been home the longest.
You get paid per day that you stay home. Sounds good. But I need to go to my restaurant. I need people working at those restaurants I need to go to. And I need people at the theater so I can go to the theater. It's all about me, in case you haven't figured that one out yet.
Yeah, Nick.
The thing is, but to get these people back to work, so I can go to the theater and go to the restaurant, go watch movies, go watch the symphony. To get them back to work, we need to get them certified.
Well, Nick, I was reading the stimulus. And they rescued the theaters and the arts and entertainment. I think they gave them a 150 million stimulus package for the arts and entertainment. The Kennedy Center got a $25 million endowment.
Yeah, but Kim, all they're doing is handing out money. Okay, there's a big difference between handing out money and
they'll be open when you're done. They got the money to stay open.
Okay. Well, the thing is, give them the money with a condition. Condition you get tested, and condition is that we get to track you on your cell phone in case you run into somebody who's infected. And that's what they do in South Korea, which in South Korea is highly densely populated. The thing is would blow out of complete proportion unless they did something smart. Now realize, doing things in the United States, we do things here all the time. Doing things smart, that's a whole different story. I mean, if we were so smart, we wouldn't be leading the world in coronavirus, right? So something's missing here. We wouldn't have dismissed our pandemic specialist a year before this happened, right? We would have listened to this guy called Bill Gates, who has really nothing to benefit from, who goes to TED Talks and saying, this is something we should really look at, but we didn't do any of it. Instead, we waited the last minute, and now all of a sudden, we're going to see what's going to happen. And that's not going to work. So the thing is, we need a plan, and we need to get these vaccines ready. Rather than right now, we're just saying, we need more ventilators. We need more Band-Aids. Great. People are getting sick. People are dying. Let's get more Band-Aids. That'll help it.
But we're going to need the ventilators for a while because we're still 10 days behind the test results. So there are people that are sick right now that don't know it, that are going to need those ventilators. And just like patients, all right,
Alexa, coronavirus. Yes, tell me about the coronavirus, Alexa.
I found something about coronavirus. Would you like to hear it?
Yes! Artificial intelligence.
On December 31st, 2019, it was reported that the coronavirus strain, COVID-19, was identified by Chinese researchers in connection with pneumonia-like illness based in Wuhan City, China. On March 11, 2020, due to the global spread of the virus, the World Health Organization officially declared it a pandemic. As of March 30th, there are over 720,000 confirmed cases worldwide. For more information, try saying, "Give me an update on the coronavirus."
Oh, wow!
If you would like to donate to me,
That's Nick's best friend.
Alexa.
He carries Alexa everywhere he goes. She is in his briefcase.
That is artificial intelligence. And you know what artificial intelligence does? Come on. All it can do is regurgitate the facts. You know, how many people have died and these many people died. Okay, think Alexa for me forward. No, Alexa, they can't do that. I mean, they're good at digesting facts.
Certified.
Listen, they're good at chess, right? But the thing is, if you said, "Hey, come up with a solution," but we'll ask her, Alexa, what is the solution for the coronavirus?
These actions include washing hands, limiting touching the face, avoiding contact with those who are sick, remaining at home if sick, covering cough or sneezes with a tissue, and disinfecting items frequently touched.
There we go. She got the solution, right? Oh, wait, there's no vaccine yet. Oh, dear. So Alexa can only do so much. I mean, she's pretty smart, but in some respects, you know, it's what artificial intelligence is.
Have you ever seen Alexa and Siri fight? Have you ever seen the two of them?
Oh yeah, they hate each other. Yeah, they
hate each other.
I can't do anything about that. I can mediate that, or else if they want to hire me as an attorney, I'll represent one of them in court. But other than that, there's nothing I can really do about those
I
guys.
was there. I had one on my wrist, and Alexa was over here at CES.
Yeah.
And they got into a fight.
Yeah, but they're good at mechanical things. Like chess, they're actually very good because they can calculate things. They calculate things better than humans can. When it comes to lateral thought, they really don't have that yet.
Or empathy.
Yeah, empathy. Well, who cares about empathy? I mean, if you're a computer, why do you care about empathy? But they're building it into their programs to go, oh, I'm so sorry all your people died. Okay, so they're building that into programs so now that they are more empathetic. But again, the thing is, lateral thought, they're not that good at.
Let's talk about, though, the technology that we can be investing in, innovating, moving forward from today forward. You know, financially, how can these things fit and help us moving forward? You know, ask Alexa, how can we fix the financial stock market?
Alexa can't figure the financial stock market, you know. And some people are going to say, well, it's not broken, because I did my review, check the Dow, it's up like 32 points or some crazy
there you go. It's self-fixed.
You know, and then everybody goes, it's fixed, and it's not. See, the real problem is it relies on data that they receives instantaneously to make trades, usually it's down 171. Okay, but even though it's down 171, you haven't seen the worst of it yet. It's got to go down, because as the unemployment numbers skyrocket here in this country to 32%. That's the prediction, with over 100,000 people dying. Okay, what do you think? The markets are going to go, well, that's okay. You know, unemployment at 32%. Oh, but we got a stimulus package, so everything's fine, right? No, it's not fine. Like I said, they got to get people back to work soon, and we can do that through testing and certification. Without that, you know, we're going to do our leaders. We'll see what happens next. And
I got a question. India doesn't seem to be so concerned about the financial state. You guys are more concerned about the health.
So Kimberly, actually, it is not that we are not concerned about the financial thing. The only problem is we don't have a solution. There is we need to understand that we need to accept what it is. The problem with most of the Western nations is that they are not able to, it has hit them by surprise, I would say. Give the benefit of doubt to your leaders also a little bit. But the problem is that, one, there was no immaculate planning, which is very difficult to plan for a disease like this. The other problem is that people are still not accepting that there is a problem. So they want everything to speed track. What they don't understand, unfortunately, is if they don't live to see that speed tracking, how is the speed tracking going to happen? So exactly. Unfortunately, we need to understand that the financials have to be thrown out of the window at the moment, unfortunately. Because we need to understand that first we need to survive out of this before we get into the finance.
Mm-hmm. Yeah.
And anyway, I'm telling you, you've seen history. There has been great recessions also. During the world wars also there has been recessions, right? But still mankind survived.
Mm-hmm. Yeah.
So I'm sure that the once this whole thing is over, you will have new kind of opportunities arising out. The whole crux of thinking is going to change a little bit. I hope that is going to change because we need to invest more into humans per se. Our whole thrust has more gone into different kind of things which we are. I mean, look at what is happening all around the globe.
Well, you know,
So
one of the problems,
I agree.
Dr.
so
Tula,
we are all looking inwards. The problem is we are all looking inwards. We are not looking outwards. And especially the Western countries, they've already looked always inwards. That they always did things with some kind of a motive there that how is it going to help them? But what they forgot was that ultimately, see, now this is a prime example of the world being connected. A disease which started in some other zone has now hit everyone hard. So unfortunately, that is what it is. Now the world has become a family. Some countries you may not like to be a partner with. Unfortunately, still they are going to. I mean, even if you don't want to, I mean, share partnership with them, still they will. I mean, unfortunately, I mean, you will be embroiled in some kind of interaction with them, whether you like them or you don't like them.
well, I mean, some of the problems that we're seeing, of course, relates even to our education system. I mean, let's face it. How many people here, when you were in high school, took Pandemic 101? Raise your hand. Anybody take Pandemics 101? No. You know, so the thing is, we are given no education. I'm not even sure if I can find a pandemic course on the internet. Ankit, is there a pandemic course on the internet?
I've asked to
Has,
find it out.
has anyone
But
seen? Okay, there's courses on everything. There's algebra, you have biology, you take chemistry, you take history, you take world history, you take pandemic 101, right? No, you don't. Okay, so the thing is, there's not even a basic course on this. How can there not be a basic course that shuts down the entire world?
There must have been a course in it somewhere because we had a pandemic expert we fired last year.
Yeah, I know. He may have taken Pandemic 101. But the thing is, Pandemic 101 was never offered in my high school, never offered in my college, never offered anywhere. It's like all of a sudden, oh, pandemics. We don't know what to do. You know, there's not even the basic courses out there.
You know, Nick, now I got to think about this.
Can you imagine if we trained our airplane pilots with the only medicine found? Let's take it stable. There we go. That's it, Ankit. You know, that's the only medicine that we can find. That's the extent of our education.
Ankit, I want that on our photo now. I don't want mapping the coronavirus for IBM TV. I want that. That's what we got. I love it.
Yeah, that's the extent of our education and knowledge when it comes to viruses. You know, we other than that, we know nothing about it. We're not trained in it. We don't know how to prevent it, and we're doing this as we're going, and we're going to wait and see. You know, when there could actually be a course on it, there could be a systematic way to, like I said, find solutions to it besides the vaccine. And and again, our pandemic specialists were all fired in 2018 because this wasn't supposed to happen. Because believe it or not, in our country, some people believe that you should never get vaccinated. It causes ADD, or it causes some weirdo stuff in you, right? They do, Kim. You know, you just talk to people here. I'm not going to get vaccinated. Why not? Because the pharmacy's trying to, you know, make more money off me. That's what they say here. But see, you guys don't know that in India. But we have a whole class of people like that believe A, the world is flat, and B, that's over here in the United States.
Yeah, we still have people that think the world is flat.
We still have people here that think the world is flat. I hope they don't have any over there. Okay, and they believe, oh, vaccines? That's a myth. That's a conspiracy. And they never heard of smallpox, malaria, you know.
Well, right now we still have people who think COVID-19 is a made-up
hoax. And the thing is, and that's the reason we shouldn't give them the 1,200. We should make them go in and get tested. Well, I don't want to get tested. Fine, no 1,200 for you. You know. Okay. I mean, the thing is, we need to, like I said, we need to get a little bit serious about this rather than throw things at the wall and hope that they stick. I mean, that's not a real smart solution. And we need to get serious about this, tracking people like they do in South Korea.
Well,
Not
we
actually
can do like our president does. We can just Twitter it away, right?
Yeah,
Just
with send a Twitter. COVID-19, we're coming after you. You're very bad. Yeah, put that on Twitter. That'll stop it. You know.
I just, we got to get back to some of our basics, and understand that it's not black or white, brown. It's no race, no religion.
It's an international problem. Like I said, I didn't know where Wuhan, China was. I bet half the people in America don't know where Wuhan, China is right now. If we polled them, where's Wuhan, China? Is that south of us or north of us? They don't know. They don't have a clue.
I get comments from people I've never heard of the places from before. So it's everywhere. It's everywhere.
Yeah, and the thing is, you know what's going to happen tomorrow? I can make my prediction tomorrow. And Kit, you can hold me to this. We're going to have an increase in the amount of people that have coronavirus in the United States, 10 to 20,000. Okay, we're going to have an increase in deaths of people in the United States. We're going to have an increase worldwide, and we're having an increase in deaths worldwide. Is that a hard prediction? No, it's pretty easy.
Where I want to show you a graph that is interesting. I'm going to show you a graph that's very interesting. Hold on just a second, because there is a place that has a decrease now, like a very big decrease, and this really, but you'll recognize this place. And I'm going to see if I can get the
South Korea. Somebody actually had a decrease. Somebody's actually
this is the Netherlands.
Oh, the Netherlands. Yeah.
Look, it's dropped. They actually have a decrease.
You're kidding.
No, look at the graph.
Yeah, I see the graph. Okay. Maybe we should talk to the prince. Remember, we've had him on.
I'm going to get the prince on the phone. I am.
But I think Dr.
Look at this. Look at the drop. Look at this. Look at this.
Okay, that's good data. That's coming from the Netherlands?
That's coming from the Netherlands.
Okay, see, that's what we need to see.
And the Dutch are very like the Italians.
Yeah.
Yes.
So they are their cultures are very similar. They love to eat with each other. They love to hug each other. They are typically bandits at home. They will tear the whole place down laughing.
Right. Oh, no, there's no question. And it's one of the most dense countries in Europe is the Netherlands. I mean, the people are on top of
But look at that graph. They got
That's good. That really shows that they've taken things very seriously.
I would like to ask can the graph can go up as well? Because I mean, it should go down for at least a week, and then only we can say that it's going down.
Right, we'll watch it, but I'm just.
Hey, Kim, get the Prince of the Netherlands on again. He's been on our show before. This dude's pretty sharp.
He's really smart.
Yeah, he actually does startups in Netherlands. Because I guess if you're a prince, you're kind of out of a job, sort of. At least the ones in England are. One got banished to Vancouver, Washington, or something. Vancouver, British Columbia. Remember, they kicked him out of the royal family. Oh, you're out of here, because you want to do something independent. Goodbye. Out the door he went, and he ran to Canada. He ran to your country, Sasha. He goes, well, I'm going to go flee to Canada. Well, this prince is the Prince of Netherlands, and he stays in the Netherlands, but he's not the crown prince because he's got an older brother. Okay, so he's not going to inherit the throne. Oh, well, too bad. So what is he going to do? He actually works in the startup community. Kim has interviewed him a couple times, Prince Constantine. He should be on our IBMTV website. And you have his email address, Kim. Give him a call. Do it right now. What are you waiting for?
Yeah, I will. I'll get him. I'll see if he's going to be available.
Tell him we don't have time. You got to get him on now. Okay, tell him we need to talk to this boy now.
You want me to call him now?
Yeah, give him a call. You got his phone number. Hey, Prince dude. Hello, Mr. Prince dude of the Netherlands. Constantine, remember me? we need to figure out what you guys are doing over in the Netherlands, because we ain't doing anything right here. We're going down the toilet pretty fast here in the U.S. maybe.
But that is curious to see such a drop, right? To see such a drop.
No, that was impressive. I don't know where you got data from? I haven't seen that.
That's the world meter. I only use the world meter because that's who CDC uses.
Oh, really? Wow. No, that's pretty impressive. That's what we need to see here. And we got to find out what they're doing over there because we ain't doing it over here, whatever it is. We're going like this, off like a rocket, you know. And by the way, don't do it too soon, Kim, because then my prediction won't come true. I told Ankit we're going to see an increase tomorrow. Okay, so we can't implement these changes yet. Otherwise, I'll be made wrong as the coronavirus actually goes down. So we don't want to move too fast on it. But yeah, friends.
And Nick, what I'm presenting right now is the coronavirus tracker what we have developed in India. So you just need to click here, and based on your GPS, they will let you know that what is the nearby case of COVID-19. So
yeah, but
click here.
Yeah, but what is this? You have a whole group, a place where no one has it.
Yeah.
And Kit. I mean, you guys. Well, I don't know why you guys are staying home. You don't even have a problem. Go out, spread the good word. You know, why are you all staying home? I bet there's a lot of people in there go, why are we staying home? We don't have a problem. Well, there's only 1,000 people that are infected. What's the big deal? By the way, that's how we thought until a couple weeks ago. What's the big deal? Boom. That's the big deal. So, yeah, and then South America. But South America, down in there, that's the Amazon, buddy. There's someone who lives there, you know? And Argentina, come on. Oops, there we go. That's more like it. You know, there's quite a few people there. But still, that's negligible. There's certain places that are just negligible. Oops, Africa's starting to get it. This isn't looking too good. Oh, wow. You know. So the middle parts, that's interesting. I wonder why that is. You know?
Nothing in this.
Yeah, nothing in Siberia. Of course not. But come on, Sasha's from Siberia. You know? He was the only guy who lived there. He goes, I could live there. There wouldn't be people for hundreds of miles in Siberia. You know? And then the thing is, if you do,
there are no people, no coronavirus.
Sasha, if you're in dude, if you're in Russia and you get the coronavirus, you're sent off to Siberia. Okay, so I mean that's kind of the way it is.
Eastern Highlands, anyway, their population is very, very less. I presume I'm right, Sasha?
Yeah, there's no one lives there. I mean, you know, it's all it is frozen tundra until global warming.
And in fact, I was going through one of the programs where they were telling that they are inviting people from, investors from a lot of countries to try and set up certain kinds of resorts and, certain things in these Eastern Highlands.
Mm-hmm.
That is the eastern part of Russia. Am I right, Sasha?
Yes, only certified investors.
Oh, well, why don't they have certified investors that are certified COVID-19 compliant? Then they can come into Russia. There we go. And if you don't obey their leaders, you can either be quarantined for 5 days or 15 days, I think it is, or you can spend 15 years in Siberia. Your choice. See what I mean? So they have a different, motivational thing. 15 days in quarantine or 15 years in Siberia. Which one would you like? So they all voluntarily quarantine. Now, see, we don't do that here, but we could do is say, do you want the 1,200? Yeah, we want the 1,200. Well, you got to quarantine yourself for 15 days. Oh, and then you have to pass the COVID test. Oh, then you get your money.
Nick, you forgot about expropriation of all your personal assets.
Oh, that's a minor thing. That's a minor thing over there, you know?
You send all your money to Nick to be cleaned.
Hey, I've been to St. Petersburg, Russia. It's a beautiful city. I mean, because I just love St. Petersburg, Russia. And the Russians were really nice. As a matter of fact, the food was really good. Sasha, right along the Neville Prospect was really good. The only problem I had is the Azerbaijanians that pickpocketed me when I was at Peter and Paul. Seriously, I got pickpocketed. I was going, dude, because what they do is they bump you. One guy bumps you, and the other guy reaches in your pocket. And when I got bumped, I go, I'm not used to getting bumped. I'm a big guy. Then I checked my pocket. My wallet was gone. But see, this American doesn't carry cash, baby. I carry credit cards. I got lots of credit cards. Oh, boy, do I have credit cards. I can show you how many credit cards I got. I got tons of credit cards. This is America, baby. Everything's debt, credit cards. And that's all they got was my stupid credit cards. And I thought, boy, you guys didn't do too good off of me, man, because you're not even making your hourly wage robbing me because all you got are these credit cards I canceled on. So they got Zippo, baby. Zippo because all I got is credit cards, no cash. But I did get pickpocketed in St. Petersburg, Russia.
Some here too.
Oh, come on, man. You can't.
But I'm going to tell you something.
Come on, you Canadians, you ain't even close. And you Indians, come on. Forget it. I haven't gone through this one. I haven't gone through this one. I haven't gone through this one. Come on, I got plenty of these.
Are we playing cards now?
What? Well, look, I got more credit cards. You know,
let's play some poker. Are we playing cards?
Yeah, we can play credit cards. I mean, well, that's what America's all about, man. Credit. And you know what? You know what's happening with the $2 trillion? Do you think we're actually going to manufacture $2 trillion? Nope. No. We're putting on our credit card another $2 trillion. Who cares? We got 20 trillion right now.
They're going to give us a digital wallet, so it's going to be Bitcoin.
Yeah. Hey, it's just going to go into our debt pile. We're just.
You know what is funny, Nick, is the Federal Reserve and the government has been making laws against Bitcoin. They won't let us use them in the U.S.
Yeah.
So they keep making these laws. No. And now they're making a Bitcoin that is controlled by them.
Yes, of course. Yeah, we do want to control the currencies. I mean, come on, that's a great thing to have. And as the Federal Reserve, and by the way, you can see our interviews with the Federal Reserve on IBMTV.
One. The others have to be
post-production yet. But the thing is, the Federal Reserve is great because they go, we stand behind our currency. Well, what happens if we need cash? No problem. We have infinite cash. That's what I said. Not only that, if we need more cash, we can print it. So the thing is, they're going to print $2 trillion and send it out. What's the big deal? It's only a couple of trillion.
Tell everybody how much they burn every day. How much do they burn?
Millions. And that was just in the Federal Reserve of Chicago.
30 millions a day. 30 million a day.
They burn it. You know why they burn it? Because currency gets old and they need to get rid of it. So
look, I have a question. How much we are spending on global warming?
On what?
How much we are spending on global warming?
None.
Hey, it's solved. It's solved. You don't understand. This is the best thing that has happened to global warming. Look at your city in New Delhi.
That is what I'm asking.
Your polluted city is getting cleaned up. Do you know why your polluted city is getting cleaned up? It's because people can't drive around anymore. Now, in China, they make it cleaned up. Remember, they used to have bicycles. We don't want bicycles, we want cars. No, they were stupid. They should have kept their bloody bicycles. It doesn't pollute. But, we got to have a car. And car pollutes. And then Beijing, big cloud of pollution. You know, that's not right. So the thing is, what's going to solve global warming is the pandemic.
So we are saving a lot of money. We are saving a lot of $1 billion for coronavirus.
Look, New Delhi would always have pollution except for this. Okay.
Yeah.
Okay. Now this is going to clean. You're going to look around. I didn't know there were buildings in New Delhi. I'm not able to see those in months because there's all this fog. It's all gone, and you'll actually be.
After maybe like 15 years, I can see the sky clearly with a lot of color.
Yeah.
We are also seeing the birds flying after so many years.
I know, and right?
We can listen to the birds now.
Yeah, what's that? It's the sky. I didn't know we had one. Okay, and you see it in New Delhi. They're going to look around. Oh, there's a sky up there. I didn't know there was one. So there's some benefits to this pandemic. Maybe the pandemic is a way to correct the problems that we've had for years. Okay, you know, and we got to look at it that way. And one of it is global warming. Get rid of it. Pollution. Get rid of it. Reset everybody. Get rid of it. Okay, it kills old people. Oh, well, you know, the thing is, I'm not going to say get rid of them because I'm one of them. But the thing is, what happens, it changes the whole composition of who we are and what we're doing. Connecting people globally. Well, I don't think we're connected globally. Yeah, tell the people in Wuhan, China that. Whack. You know, Wuhan, China creates a virus and it goes all over the world.
And I know that we need to wrap up here soon, but let's bring that to a point.
Yeah.
How will this impact us politically, globally, given the relationship we have with China previous to this? What do you think is going to happen now? I mean, and I'm curious, how does India perceive China? But how is this going to be a global impact?
So I think it should be.
I have an opinion. First of all, we're going to do more business with India. Okay. The reason we're doing more business with India is because the Indians don't produce viruses like China does. Okay, so we're going to do more business with India. Number two, we're going to do more business with India because they bloody speak English, and I don't speak one word of Mandarin. I don't know about you, but Mandarin is like light years away from me speaking. So what's going to happen is India and the United States are going to get closer together, and China is going to be left with the Wuhan problem, whatever they've got over there. And so we're going to send our manufacturing over to India that can manufacture, speak English, and we can communicate with them, and they don't manufacture viruses. That's my opinion.
Hey, Mohammed?
He agrees with me. We wear the same hat.
Today is a very good news regarding your question as well. India has given some good orders of healthcare products to the Turkey, South Korea, and Vietnam, and not to the China. So
Not
it is
to
a one
China.
step ahead.
Not
It's
to
a one step ahead.
Hey, Kim, IBM TV has been seen all over the world except China. How do they block us? That's what I want to know. They block us.
They block everybody.
I got people calling from the Philippines. I got people calling from Kenya, in Africa. I got people in Australia, Nepal, all over the world except China.
KTAS. Have you ever heard of KTAS? QATAS?
I don't.
Yeah.
From KTAS. So, yeah, and then China. Blip. So
and you won't believe our viewers are asking that can someone represent anyone from China and talking about the COVID-19 because we are covering this.
No, I tried the other day, Ankit. I got somebody on Hong Kong. The first thing they wanted to do is say, "No, I have no problem to talk to you about it. By the way, I'm a banker. Can you send me your banking information?" He's trying to scam me. I'm like, are you kidding me? You're in Hong Kong, and our first communication we have, and you're trying to scam me out of all my money? No, that ain't going to work. So I did have one communication with somebody in Hong Kong. It's really, really tough. And it's been that way, Kim, for a year that we've done IBM TV. Remember I said we got into every country except China, you know? And honestly, even today, I don't know how they block us. You know, there's got to be some way that they go, oh, this is international.
It's not just us. If you look at when we went to the PBS conference and we talked with the Nelson Ratings and that company that has global connection via networks, we're not the only people they block. China has complete control over the people.
I don't feel so bad anymore.
No,
we're just one of many that are blocked. So you know,
there are a lot of campaigns going around that say no to Chinese products and focus on. I mean, our product or maybe product from different countries, and so I think the best part maybe I can't say online, but we have to isolate those people who are not supporting the world right now.
Mm-hmm.
So that's the next step.
Yeah, well, in India, as you well know, the head of IBM is from India. IBM has more people working in India right now than they do in the United States. I mean, so the thing is, there's a lot of trade going on between now India and the United States. And so I think it's going to help the economy of India tremendously because you guys don't manufacture viruses. You know
that we have a lot of relationship with China because of IBM and Lenovo, right? Yeah. And Lenovo became the Chinese entity that IBM offloaded all of their hardware equipment through Lenovo, which was a Chinese. And I have tried to even reach out to people in that company, and it's very shut, very quiet, very, very quiet. So I know a lot of people there because of my relationship here in the U.S. So I think, you know, they're trying to wait out the storm and hope that the Chinese aren't going to be cut off.
Yeah. Well, if you think,
I agree. And Mohammed, I think that we're going to cut all of the people from the world that did not adhere to these solutions. Yeah. I think we need to reach a helping hand to Uganda. Yeah, wear the glove.
But Kim, think about it. Okay, let's imagine we develop a vaccine.
We are united, actually.
We develop a vaccine, and we need to mobilize people, and we need to manufacture lots of them, and we need to find a place where there's lots of people that manufacture stuff.
But first, we got to stop the spread.
And your choices.
We got to do both, right? We got to stop the spread and the vaccine.
Okay, but once you get the vaccine, your choice is to award the company that's going to do it either in New Delhi or Wuhan, China. Where are you going to award it?
Come on.
I mean, this is
actually, it might be India saying, "Hey, we got it, and we're going to share with you."
Yeah,
so
India's going to manufacture the vaccines. Watch, it's not going to be Wuhan, China. Not that we have anything against Wuhan, China.
But I think, Nick, if Wuhan manufactures the vaccine, I'm not sure whether people will buy it. I am hesitant to use the product because what happened in Spain and Italy, they have got a lot of products from China during COVID, and nothing is working.
Yeah. Well, but the thing is,
I'm a businessman.
Yeah.
I'm a businessman. I'm watching this thing very closely.
Mm-hmm.
The main target is New York City.
Right.
Why the New York City, the main target? Now the most affected is the American only.
Mm-hmm.
So target is very clear. Second target is the Europe, and those countries like Italy, Germany, Spain, and these countries are manufacturing. They are the manufacturing hub for the medical devices and the innovative medicines as well. So they targeted those countries.
Yeah.
Right now, the China is supplying goods to the Italy right now of millions of dollars. Why?
let me enlighten a little bit of subject matter on why it was China, Italy, and New York. And you have to remember the fashion industry is tremendous. And the fashion industry relies on Italy for design and New York.
Yep.
And then the buyers and for manufacturing have become China in the last 8 years. So China had become the main manufacturer of all the clothing. And the reason why I know this is my clothing sizes have changed. Okay. They make things way off the clothing chart I had 5 to 8 years ago. So I have to buy sizes that are different, but they manufacture all of the clothes in China now. So that's what happened. That was the bridge. That's why I started piecing this together about a week ago. If you map out business, that's your fashion train right there. That's your fashion trail. I don't think it had anything else to do with anything other than the fashion market is so heavy between those three places.
Yeah, and Italy, they also live very close to each other, so they were just caught off guard. When I was there several months ago, the thing is, you're sitting on the third floor. There's people on the second, the first, right across the street. The cities are medieval, and they're very congested, very close to each other. So the minute they get one disease, it goes to everybody. Poof, and they just didn't have any protection.
But India is the same way. They're very tight-knit family, very close.
Right.
Yeah. India is very much the same way.
And then New York is also, people live on top of each other. I was in New York a couple weeks before that. So just as this thing hit, and then got flights out because I was scheduled to get out anyway. But in New York City, they're on top of each other. So the minute one person gets it, everybody gets it in New York and New Jersey. And that's really what happens. In the rural areas here, it's not as big a deal as it is in the major cities in the United States. And this is...
Do you think FBI or maybe any of your agencies are figuring out what's happening? Because there are a lot of whistleblowers and stories coming from China now. And people are watching it on, it's on the trending list because China is still not sharing the data, and they are claiming that they are recovering, or people are recovering from China. So,
come on, Ankit. We're not going to listen to what goes on in China, man. Of course, they don't share the data. They don't let IBM.
But one of our agencies like FBI or maybe someone from India can figure it out, because they might be having agents in China, and they can help us in getting those things.
Yeah, I mean, the thing is, eventually they'll open their doors, but maybe not this year. And we'll find out what actually went on, because somebody will spill the beans as to actually what really happened over there. It's just not going to happen anytime soon. So we should take the data from everywhere else but China. Okay, so take the data from South Korea. That looks pretty good. Follow their example. Follow what's happened in the Netherlands. Kim needs to talk to the prince and get him on again. And
I'm going to get the prince back on. But let's talk about. I want to see that racing chart you had. I'd like to share that with people. Ankit, if you can send me that. But, Mike, I would like to understand how India feels about those other countries that are not taking the precautions? And has there been talk amongst yourselves as to your business relationships globally, if you're doing them? Has there been talk about that? About, do y'all like China? I mean, I don't know. I mean,
Like China.
See,
No, so basically, I'll
They're
tell you. So
neighbors.
China is a neighbor basically, and you can't you
China
can't
is a
leave your neighbor aside. That
China
is
is a
what.
very good country, no doubt about it. But their vision is very dangerous actually.
Mhm.
They believe in expansion strategy. They believe in expansion strategy. When we talk about India, India has never ever attacked to any countries in the world right now. No reason why and how. We believe in the submissive nature. We believe in the protection of the humanity first. But the China is very much aggressive. They believe that right is might. They can do anything else. So this is not the right time. It is a 7 billion population family right now of Adams and Eve. We have to think like a family first. We have to take care every country and every single human being like our own family.
Mhm.
So this is the need of the hour. We cannot differentiate on that. See, money is a byproduct. You always say the money is a byproduct. Once we have a very good relation with the America, we will be having money following with us because America is a very rich country,
Mhm.
one of the 18 trillion economy in the world. It's a
Right.
big economy.
But
So
I think
once
respect
we will
comes from
having
heart now because
association, yeah, once we will having association with America, so we will be having association of the economic balance as well.
Mhm.
But China is having dual nature. They believe only in the money. Believe only in the money. See,
So,
I
so they're,
did.
they're
So I'm
they're
taking
they're
a
a little bit
stand.
they're a little bit
I'm
like
taking a
us.
stand. I'm very much strong in my decision.
Mhm.
See, the recovery rate is 93% in China. How? They are having their antidote. They developed this antidote before the I should say before the launch of the coronavirus.
Mhm.
Because in America is the most advanced country and the recovery rate is just 0.04%. And
Mhm.
when we talk about the England, they have 0.07%. That means they are helpless right now.
Right.
That means China is hiding not only the spread of this coronavirus, they are hiding the antidote as well right now till now. So they are
Mhm.
not the friend of the humanity. They don't want to protect humanity. They started selling goods across the world right now.
Mhm. Yeah.
So the approach is absolutely wrong. This proves that China is a culprit. There is no
Yeah,
doubt about it.
China
There is
has
no
its
doubt.
issues, but
Yes.
also they're not uniform. The Hong Kong Chinese and the mainland
Yes.
Chinese think a little bit different, and I
Yes.
think it's
Different.
the Hong Kong
Because
Chinese
because
spend too
they
much.
they
Yeah,
because British has ruled them up.
right,
yeah.
Because British
right.
has ruled them up.
Yeah,
They see. I
yeah,
love British people. Really, I
yeah.
love British people and the way they are administrating the things.
Right.
I love American people and Europe as well because
Mhm.
they give priority to humanity first. Country is okay, but humanity is the first.
Right. Yeah.
They even see India is a very close ally of Europe and the America.
Mhm.
But even sometimes Americans and Europeans say, Mr. Modi, you are doing wrong, you are doing right. They
Right.
take a stand.
Right.
So taking a stand is a good thing. So
Yeah.
right now we have to be united against the whatever China has done for the world.
Mohammed, I think whatever we are thinking as a people, or maybe as a commoners basically in our country, but
Yeah,
our political or leadership, they are not thinking like that. So they are playing diplomacy in some way or the
yeah,
other to make the other person down, and that is what's going on right now. But if
absolutely,
we unite and work together and share the best practices, I think we can still win this war. Otherwise,
absolutely.
I mean, there would be a disaster. I mean, that's what we are seeing
Yes,
right now.
yes, yes,
Mhm.
yes. Totally
Yeah.
agree. Totally agree.
Right.
Sasha,
Yeah.
you are a very young person. Means you are the
He's
youngest
the
person
young
in this
guy in the
group.
group.
Yeah, youngest person in this group.
Hey,
And
and he's
see,
got the best bar in the world. And you know, I just got to tell you guys, I'm going to make sure I get to visit every one of you. But the big party's going to be at Sasha's.
Yeah.
so Sasha, how do you see this world? How do you see this world? Because in World War First, the economy of Japanese was better than the China. After World War Two, China has taken up. and now the China is the second world economy, having 14 trillion economy size. So how do you see now the world after Corona? Because you are very youngest person right now. You have seen this world better than us.
Uh, well, first of all, there's an old saying: if you can't beat them, you join them. It appears to me that lately uh, America is losing its edge in all world over. We may not agree with that point of view. We may still say that we have the best technology. I'm talking about we because Canada is basically another state of America, except that we have universal health care taken care of. Otherwise, we're not too different from America. So the situation is, if that's the case, and we have to really think very hard, is it the case or it's not? Because whatever certain president of the United States was trying to fight China with tariffs and duties and all kinds of restrictions, and it's still an open question. Did it work all well? Did he prevail to prove his point and get China on its knees and asking for more cooperation and forgiveness and whatever? No, it didn't really happen. I mean, China is doing whatever China wants to do. Now, with what's pandemic is happening in the world, I'm really scared that the life here, I'm talking about US and Canada in particular, but probably Western Europe as well, is not going to be the same any longer. And it may last maybe even a generation. And that makes me really scared because of my daughter and my grandchildren. Unfortunately, the standard of living is not going to be the same. Besides the stock market, okay, stock market today it's collapsing. Maybe 3-4 weeks, probably months later, maybe it will start going higher. I'm afraid that real estate is about to collapse, if not collapse already. The mortgages industry. So it's really incredibly difficult at this point, really to see a complete picture. I'm really scared. That picture may not be pretty. However, what we know, and I was watching today CNBC, that China is already getting out of this crisis. They're hiring people. Their industry is coming slowly back. It's not on the same level as it was before, but it's getting there. It's already coming up. So, okay, the other way of thinking is that, okay, so US, for example, is maybe 2 weeks, 3 weeks behind China. So China is already hiring and getting out of this. So US will do the same thing in 2-3 weeks. I wish it will be true. I wish, but I don't think so. It will take much longer, and then it's very difficult to picture out how recovery will take place. Who will start hiring first? When the concert will start coming back on stage, so we can start going to concert halls and opera theaters and sport events and everything else. How that will go in fact, and if it's not coming back, then we're in big trouble. So hopefully it will come back, but how? When? The picture is completely unclear, and that really makes it scary.
I want to share something with you, and it's kind of part of the book I wrote, and in the speech I give, is that things like this get rebuilt by the passion. So if you have this and this, you will recover. Just like they told me, I might never walk again, right? They told me I might not ever use my arms or walk again after I had to have the surgery and lay incapacitated. I used a computer with my voice and I continued. So it's this and this that will rebuild those things we love. People will rebuild a theater if they have to go out and act on the streets, right? Musicians will rebuild the music world if they have to play on the street corners. And we will reestablish our social way of life and the things we love through this, through our passion and through this. And that's what it's going to take. We all have it, and you will continue growing because of it. So it's your passion. And these passions will drive us to rebuild all of these things. No doubt in my mind that we're not going to rebuild. No doubt. We got here. We'll do it again. We'll rebuild that mountain. We'll rebuild the buildings. But you can't take that out of here. You can't take this away. This is why I tell people, they cannot take this or this away from me. Period. With that, when students graduate, when I speak to them, I tell them this is the most valuable piece of intellectual property you will ever have in your life. That piece of paper, it took this and this, and they can't take that. They can't take that away. We'll rebuild.
Yeah, we will, and we need to do it real soon, Kim, because I'm getting tired of this. I've been in quarantine for 2 days, and this is driving me nuts. So,
I know. You know what?
You guys get that vaccine ready and get this thing all ready.
I feel like that movie. I keep hearing people go, "Are we there yet?
Are we there yet? Wait, it's 2 days. I got to do this another 12 days. Are you serious? I don't know if I can manage to do that.
In the back seat, I just want to do this.
Yeah. Now, Sasha is from Russia, now in Canada, represents all of Canada. They all get along with everybody. By the way, if you can't get along with Canadians, you're in deep trouble. Because everybody in the world is a friend of a Canadian. Hey, come on in. Do you guys carry guns there? No, we don't carry guns. We're in Canada, eh? I mean, the thing is, everybody gets along with Canada. If you don't get along with Canada, you got to really rethink what you're doing. Because we're all friendly people.
That's where maple syrup comes from, the good stuff.
Why do you think the Prince of England or the left go to Canada? He could have chose the whole world to go to. I'm going to go to Canada. Why? Because they're all nice people there. Why? It's just who they are. They all have to get along, because if not, they all freeze to death.
Nick, he wanted to have a free medical coverage. That's why he came to Canada.
Free medical coverage. On top of that, you get free medical coverage, and all that, the nicest people in the bloody world. So the minute you say, we can't get along with Canadians, you're in deep trouble. Now China, I'd like to just talk to somebody from China. Hello, is there anybody out there in China? You have 1 billion people, but you can't just hide behind the walls there. Eventually we'll get somebody from China on. They could tell us what's going on over there. I have no clue.
They're afraid. I think they're afraid to be on the media. They're afraid of us.
I'm scared to death of media too. So that makes two of us. But that doesn't mean they can't get on and talk. Come on.
There's only
people talk like you.
From Quebec. People from Quebec don't get along with Canada. They want to get
Quebec's a separate country. Quebec almost left Canada. That's a whole different country. That's a whole different deal.
You got 49.5% vote to get their own way.
Yeah, the thing is, but sooner or later the world will figure this out. It's just going to take them a little while.
Unfortunately, there are going to be many lives that we lose, and every day I pray for them. Every day I try to do a prayer. I do this during Lent anyway, but I've added prayer for this. And, unfortunately, China they don't consider human lives anything other than collateral assets that were not valuable enough to them. And they didn't think about the rest of the world. They didn't think about the fact that people were leaving China and making other people sick. So we have to learn, and Nick, I learned this from the very successful people that we've interviewed on our trip.
Yeah,
you cut those people out of your life.
Yeah.
If you start cutting the dead weight,
we'll need to talk to them. We'll just have to talk to them. Bring them on. Bring the Prince of the Netherlands on. Let's give him a call. Find out what's going on over there, and then we'll just go from there, Kim.
Hey, was the Netherlands losing that horse race we saw? Were they in the back? Were they in the rear?
Yeah, they're going the other way.
You know what? The reason why I want that is because it looks like a horse race to me. And we are really big into that here.
Get Prince Constantine on.
Do you know about the news of Prince and Meghan Markle, they are flying from Canada to LA, and then Trump said that they are not going to protect them. Do you know about them?
The Prince.
Prince
and
William.
Meghan.
Yeah.
Yeah, that's all drama. There's so much drama.
I don't know what
Trump for security guards, and Nick and I know they come with their own security guards. The rich people have their own security guards.
They're pretty cool.
You know, it's all drama. You know, you might as well watch a soap opera.
But I don't know. I mean, we are getting news like this only, rather than we should get medical news or maybe something more awareness about it. That's what we should cover. I mean, we are covering a lot of dramas around the country, especially in USA.
We love drama here. Come on, we have Hollywood, baby. Of course, we love drama. You know, this is the best thing out there.
By the way, Canadian government announced just a couple of days ago they will no longer provide a special security service for Prince Harry and as well.
Oh no. They don't need to. You got all those Canadians. They're nice people.
You got all the Mounties. You don't need it. That nobody really carries a gun. I mean, I would be interested in seeing the crime rate in Canada.
There isn't any. Not up there where they live in Victoria, Vancouver. There's no crime, so I don't have to worry about it.
Why he need special protection? Nobody is attacking.
They don't need any special protection unless those Americans cross the border. Then they can be.
That's right, because American ammunition.
That could be trouble. 2 o'clock. I got to get going.
The colder it gets, the crime rate drops. But we got to go. I think it's time to go. I'm going to go eat lunch.
It's time to go. Yeah.
Thank you, my family. Thank you.
Take care.
Thank you.
Take care.
Thank you, my family. Nick, you got to get the handshake. We're going to teach Nick the handshake. Take care, everybody. Tomorrow.
Take care. Bye-bye.
Take care.
Tomorrow. Bye.
Bye.
That was fun. You want to wrap us up?
Yeah, I'll do it.